Dear friends of Collegium Magicorum Theatri, this is a wonderful experience that we have had since last year. Now we are going to begin with the second time of the CoMet academic sessions online. This is a great pleasure to welcome you. And well, this is wonderful. I see Professor Jürgen Wendler. Lieber Professor Jürgen Wendler, willkommen. Das ist immer so schön, dass Sie hier bei uns sind. Peter Hulling, lieber Freund, das ist fantastisch. And of course, our dear Bill Riley. I enjoy that very much and I am very glad to see you. Of course, Alan Burma from Estonia, our dear first speaker, Professor Dr. Mary Muckle. Bonjour. Ron Scherer, great to see you again, dear John, dear Ron. And John Rubin from London is also with us. Our dearest friend, Erky Bianco from Paris. And of course, our lovely Linda Carroll from New York, New Hampshire also. And Giovanna Montecalvo, ciao Giovanna, das ist sehr schön. Und Marc Bouchaillet, this is great because today we are going to honor you. And also Guy Cornu, our dear professor. So I want to thank you all. And as we know, this new time of the CoMet academic online sessions is difficult, but at the same time, it allowed us to be all together. And of course, we shall have many surprises. Ana Gloria Ortega de Argentina, Soledad Zaqueri is also a welcome new member, just as Alfonso Borragan from Santander, Spain, and also Laura Ramos. Nice to see you. Valentina, ciao, anche per l'Italia. And so we are going to see a very short video from Bruno Colombo and Roman Perus that, as you know, they are the followers from our dear honorary members Guy Cornu and Marc Bouchaillet. So we shall see that small video.
Good morning, everybody. Good morning, Eugenia, all dear members of the CoMet. Bonjour, Marc et Guy. We are very sorry with Romain not to be here with you to welcome Marc and Guy as honorary members of the CoMet, but we engaged 1 year ago with Franco Fussi to give a course, a lesson to his for the University of Bologna, and 6 months ago this date, the 6th of November, was chosen, and we couldn't change this 15 days before. We are very sorry of that, but we are very proud to be with you and to be part of the fellows of Marc and Guy. We try to keep their teaching and we would be very happy to be here, but unfortunately we are not physically and with a video, but with this short message we hope to be a part of this meeting.
Thank you, Eugenia. Thank you, Marc and Guy. As Bruno told you, we are very proud to work after your fantastic work, and we try to transmit your inheritance. Thanks a lot, and see you soon.
See you soon, and have a good meeting.
Have a good meeting, yes.
So this is great to see this video. And as you know, everybody has the experience that sometimes our wonderful vocal folds videos are having small technicians delays. So I hope you enjoy. And I am very grateful to the speakers, Professor Dr. Mary Muckle, for Reinaldo Yasaki from Brazil, from Dr. Nicholas Gibbons from London, England, and also to Professor Dr. Ismail Koshak from Turkey, and of course our dear Professor William Riley from New York, United States. So I hope you enjoy, and after these 5 speakers, don't forget to write your questions or comments in our chat. I am going to moderate as always. After these 5 speakers, we are going to make this small tribute to Marc Bouchayet and Guy Cornu, and then after that, we see the welcome videos from Professora Soledad Sacchieri and Professor Dr. Alfonso Borragan. So enjoy that, and I thank you very much to be here with us today again. Personalities in the phonosurgery. As you know, he is the secretary of the Association of Phonosurgeons. But he is also, in his long career, he is also director of the Voice and Swallowing Center at the Centre Hospitalier in, I'm sorry, but this is very, very, very small, in Luxembourg. He is at the moment also working in very many patents, like he has been working with micro instruments and robotic, mainly in micromanipulation for dissection and for incisions. And also, he is a very active participant in international, European, and also Belgian and French conferences. He was the chair for developing with some other personalities the master degree in logopedics in Belgium. He's a member of many associations, collegiums, societies all over the world, France, Belgium, Europe, and of course, international. He's a founding member, and also he was the past General Secretary of the European Laryngeal Association, and he is a past professional for the European Federation of the CHL also, and this is the European Federation of Otorhinolaryngology, and also he has the European Confederation for the European CFL, Head and Neck Surgery. He has different honorary distinctions, and also he has made very important publications in important international scientific magazines, and also he has many chapters of the books. So I am very, very honored to present to you the wonderful the presentation that he kindly sent to us for today.
Dear colleagues, dear friends, first of all, I would like to thank Eugenia for inviting me on this session of CoMet on COVID-19 and the artistic voice, which is a very important topic these days. As you know, COVID is severe acute respiratory syndrome, SARS, and this COVID-19, 2019, was initially detected in Wuhan, China. Its pathogenic way is using angiotensin-converting enzyme to enter the host cells and target the alveolar cells. It will distress the immune function and induce an hyperactive inflammatory system, leading to a storm on cytokine production. The major symptoms are shortness of breath, fever, pneumonia, that can be fatal in vulnerable individuals, especially indeed we are used to see from time to time anosmic patients. One of the problems is the long-term symptoms, fatigue, dyspnea, brain fog, chest, neuronal injury, and possibly increasing or revealing cognitive impairment like Alzheimer, Parkinson, and multiple sclerosis. And from the lung point of view, high healthy, so persistent inflammatory interstitial lung disease. The only treatment preventive so far is, as you know, vaccination. There are different types. The more popular one is the mRNA-based vaccine, but besides this, we have the live activated vaccine, the DNA vaccine, inactivated vaccine, and so on. Besides the vaccination, we have very poorly devices like paracetamol, steroids. Avoidance of benzodiazepine is recommended. Anticoagulation regimen is very important for some people. And of course, for possible anesthesia, we have to be concerned about the cardiac and lung activities. Besides this, we have been informed recently that the company is starting to sell an oral antiviral medication, but we don't know so much about it. In laryngology, what we have to deal is mainly people presenting respiratory difficulties, with an intubation in the mean range of 14 to 21 days after necessitating assisted ventilation and having to get rid or still needing a tracheostomy. We have to deal with voice and swallowing difficulties. At the beginning of the pandemic, it was recommended to perform this video stroboscopy or even video fluoroscopy only for patients in urgent situation, because it was considered with a high risk of contamination, and delay was recommended. But presently is less. We have less strict recommendation about that. So all in all, that induced a delay in diagnosis, and the median delay was of 107 days. If you go back to the first recommendation, there was many of them. So 65 recommendations were presented by the American Academy. But now again, with the vaccination, we don't have fortunately to follow them so far. To help in the consultation, we can have a kind of idiaphone like we have in the post offices. We can have special mask with perforation allowing the video endoscopy to go through. I still use them for very risky patients, but if not, I'm just back to normal activity, just wearing gloves and mask. Situation is easy now in comparison with some 1 year ago, since the vaccinations. For instance, the patient in Luxembourg have to present a European certificate, or just to go for a PCR test, a fast test, and to encourage people to get vaccinated. PCR tests and fast tests are presently at patient own expenses. Complaints, we know them. It's cough, chest pain, secretion, and some of them still present hair pain, headache, fatigue, nausea, arthralgia, but there are more general symptoms. If the patient is a professional and not infected, what we see that they present a significant amount of stress and anxiety, vocal fatigue, and they do care more about the social aspects. The quarantine itself doesn't have a real impact of the voice, so it's more, I would say, psychological concern. Recommendations is still, but less and less virtual rehearsal, mask wearing, instrument cover, small chorus, outside performances, good ventilation, and shorter rehearsal. But these recommendations are really decreasing these days, thanks again to the vaccination. Luxembourg is now reaching 80% of vaccinated people, so performance in the theaters are possible again with just a small recommendation. Wearing a mask is not necessary if you are in seated position. Regarding laryngeal abnormalities, they are mainly located at the glottis, and what we have to deal with real organic disorders is scars of the vocal fold, with disturbances of asymmetry, closure, periodicity, and mucosal wave. We have unilateral vocal fold immobility, posterior glottic stenosis, and subglottic stenosis. For the speech therapy, again, session of speech therapy in presentials are allowed again. Some people will still prefer telepractice, but yes, it's possible, but not easy to do because we are losing in this way the face-to-face interactivity. There were some concern about the projection of particles, saliva and so on. But generally speaking, if there's, let's say, 1 meter between the patient and you are doing safe. And what can be said is that the vocal exercise produces a slower flow than a long exhalation. So if you are wearing a mask, you are doing completely safe these days. But if you are afraid of possible injection, allowing a meter from the patient give you a safety position. So from the therapeutic point of view, we have to deal with the scar of the vocal fold, like in this case. And the possible solution in this case is an injection, laryngoplasty. I would use hyaluronic acid to inject the cord and to try to make the scar as soft as possible. Doing this, you cannot promise a normal voice, but you can promise less fatigue and increase the maximum foundation time, and in a certain amount, an improvement of the voice quality. In this case, for instance, the closing was better and the vibration was observed again for this patient with a severe scars of the vocal fold. We have to deal with unilateral vocal fold paralysis, and we can expect a recovery. So in this case, it is a unilateral vocal fold paralysis after 2 months. And in this case, a positive.
The vocal cord is still a little bit bowed, you see.
Solution is an injection. Again, an injection laryngoplasty that you can perform transiently through the melanamine way from the thyroid notch or through the cricothyroid ligament. In this case, this is a transnasal injection into the vocal fold, and the goal is to improve the closing with hyaluronic acid, of course, temporarily. But you expect that the voice can recover after 6 to 7 months. If you don't expect any recovery, in this case the patient was injected with radius, he was improved for a time, but the gap was too important and the vocal fatigue was there again. So in this case, what I did is a medialization, thyroplasty with the Montgomery implant. I like it very much because it's easy to manipulate. You have different sizes. It's very comfortable technique, and you know that thanks to that you can improve the closing and from that the quality of the voice. If you have a bilateral immobility and you expect it temporarily, you can of course perform a tracheotomy, but I like very much the Lichtenberger technique, performing a pexy. Like in this case, you stretch the vocal cord at the level of the vocal process and you fix it on the skins. It's also a way to assess in case of scar of the vocal fold if the patient will be improved with a partial arytenoidectomy. If you stretch the cord, you can leave it 3 to 4 weeks or more, and then if you have a recovery, you can release the cord. But if you expect a permanent bilateral paralysis of ankylosis, then of course this is a compromise, as you know, between the voice quality And the airway, the more you resect, the better the airway, but the poorer the voice, the less you resect, the better the voice, but the poorer the breathing. So it's a way to decide how much you have to do, like in this case of posterior severe scars. Subglottic stenosis, usually after this long intubation, what we have to deal is mainly a mucosal stenosis. The cartilage is not so much involved generally, fortunately. So in this case, you see the subglottic stenosis over there. What you can perform, if necessary, is a cross section of the stenosis using the laser if it is already too fibrotic, or if it's not too tight, you can go directly to a balloon dilatation with a 10 bar of pressure. Then I'm used to apply mitomycin C on the spot, 2 milligram per milliliter for 2 minutes. And also complete with an injection of steroids, dexamethasone, 40 milligram. And usually you have a very good improvement of the airway, not necessitating another open approach.
Thank you very much, Professor Dr. Marky Mackey. This was a great presentation. And well, we do know that the videos are too heavy. And sometimes we have to be patient, but they were wonderful. And well, we shall have our live discussion after the closing remarks, as always. Now we are going to have acute and subacute COVID-19 pathology on the artistic voice source and filter by Dr. Reinaldo Yazaki from Brazil. He's a medical doctor, general otorhinolaryngologist surgeon dedicated to laryngology and phonosurgery. He has a medical degree from Federal University of Sao Paulo in Brazil, specialization in laryngology, phonosurgery, or from the Federal University as well. And he has many fellowships with different voice clinics in the States, Germany, Belgium, and so on. He is responsible for the otorhinolaryngological section of endoscopy in a diagnostic medicine laboratory. He was, I'm sorry, from 2008 to 2016. So he has a lot of experience about making this diagnosis. Actually, 90% of his patients are professional voice users, mainly performers. He has active participation in national and international conferences and congresses, and he has several publications also about voice pathology. Let's hear Reinaldo Yazaki. Thank you, Reinaldo, for your contribution to CoMet.
About the acute and subacute COVID-19 pathology on the artistic voices, source, and filter. I'm Reinaldo Yazaki, a medical doctor, phoniatrician, and a phonosurgeon. And my office is called Artistic Voice Institute. The pandemic brought pitfalls to the doctors, physicians, and to the performers regarding the compromise of the artistic voices source and filter. I can tell you at the beginning, primarily, that there is no specific inflammation of COVID-19. It's really similar and almost equal to adenoviruses, infectious rhinoviruses, influenza and parainfluenza infections. And not just about the non-specific inflammation, but about what the reduced performances caused in the adjustments of the singers. And we divided the diseases, forms of the disease, in acute when it lasts less than 30 days, subacute when less than 90 days, and chronic when it's less more in more than 3 months. So this is what we have seen in our experience. Some signs of laryngeal edemas. In this case, a specific an edema of the middle third, and a change in the color of the vocal cords with purulent discharge, and a heavily red trachea and subglottis. Regarding the intense inflammation related to COVID-19, we all know that it's a new virus for the human species. And that's why our body tend to make a very strong cellular and naive inflammation because of our immune response is very strong at the beginning. And that's one of the reasons why the infection gets worse, because there's so much inflammation that our immune response cannot be modulated, and so on. There are other factors comments to worsen the disease. And the inflammation is related to the nasal cavity in an entire form. The glottal surface, the vocal cords, especially the inferior lip and infraglottal portion of the glottis, and also in the trachea and subglottis. I'm not going to talk about the lung involvement, okay? And this inflammation brings an acute structural alteration of the vocal cords and increase in the vertical dimension of the free edges, leading the singers and performers to sound heavier than normal, to sound less acute, less high, and not so high than normal, with the lack of the high tones of the tessitura, and it all is triggered by the excessive inflammation. Regarding the reduced performances, we can think about a singer that used to rehearse around 25 to 30 shows in a month. Without these 30 shows for more than 1 year, we can see that the physical muscular conditioning could go down, and the physical muscular condition worsened. And we have to always remember that we use the middle low tones in a very, very more excessive manner than the middle to high tones, because the middle low tones is where the speaking voice is. It's just in the singing voice that we use the middle to high tones. So these middle low tones, after some months of excessive use, can unfortunately untrain the middle to high tone because of lack of use, lack of training, lack of working with the middle to high tones in singing. And we have to remember that the biomechanics involved of the singing is related to 3 subsystems. The first one is the breath support, the second one, the glottal source, and this third one is a vocal tract and their articulators. And based on in our experience and practice over the Artistic Voice Institute, we will describe the acute and subacute pandemic findings of SARS-CoV-2 infection over the artistic voice. This is a larynx with an acute laryngitis related to infection, and we can see a red glottal area and a red subglottal and tracheal area. And we can see also in this field, very red field, some maculae related to purulent discharge that came from the nose. Of course, we had, in this case, to cancel the show because he wasn't able to sing the chorus of his very famous songs, and it could be a risk of damaging more the voice because of trying to rehearse above this condition. And we can see a small polyp growing here, right beside small sulcus at the left vocal cord. And regarding the acute findings, in less than 30 days, we can see an intense inflammation of the nasal cavities related to acute rhinitis, acute sinusitis, pharyngitis, and reflux signs. It seems that the infection, viral infection per se, cannot trigger a very specific worsening of the case. In our experience, any case got worse, it was because the infection, secondary infection of bacteria with purulent discharges after the 4th day of the disease. And I brought those studies just to remember how much is important the nasal cavities for the projection of the voice. The small amount of sound that goes to the nose is important for them to sound bigger and stronger than normal without too much effort. So if we have an untreated rhinitis that goes from to the 30th day of the disease to the 2nd month of the disease, maybe this is one way of having more trouble in the projection of the voice. We have to treat the rhinitis, and we have to call our patients to come back to a reevaluation in order to check whether the nose is unblocked or not. Because if it's blocked, it's interesting to have some corticosteroid sprays to reduce the time of blocked noses. And this is an example of how the sinusitis related to viral infection happens. It's related to a purulent discharge that comes from the middle meatus and goes to the nasopharynx. And then from the nasopharynx, it goes down to the pharynx and larynx, and then to the trachea. And when it reaches the vocal cords and the trachea, we will have the change, structural alteration of the uterus structure of the vocal cords, and they will have trouble in singing. And about the acute findings related to the source, in less than 30 days, we commonly see acute laryngitis and carditis and tracheitis. And many of them start to cough, because it's when the trachea is involved, we have the mechanism of genesis of the cough. And sometimes they will have hematomas related to the cough, to the throat clearing, and of course, because of trying to use the device over the infection. In our experience, the main cause of lesions and injuries on the vocal cords is the attempt of saving a show by trying to use the voice over the infection, uncured infection. And of course, there will be swellings and edemas that can be focal and diffuse because of the disease and inflammation related to the coronavirus infection. Here, you can see another patient with slight edema of the middle third in the 4th day of the disease, and a very intense redness of the trachea and the subglottal area, including the area related to the infraglottal portion of the free edge. We can see the infraglottal portion of the vocal cord here, and I know that it wasn't like this before this infection. So I had to take this performer off the show for her to get better, and she came to me today better than she was in this day. And this is another type of inflammation where you can see a very fatty vocal cord, larger than normal because of edema. It's a diffuse inflammation, diffuse swelling and edema. And that's another common. Inflammation level in both cases is increased. Então, moreover, then the inflammation related to rhinitis, moreover, that inflammation related to a common reflux they are having right now increased level of inflammation related to the infection of coronavirus. And here you can see this inflammation in the inferior portion of the vocal cords in the infraglottal area. And of course, the vertical dimension of the vocal cord changes. And that's why they sound less acute, less high, and they cannot go to the high tones. And they tell me why, while I'm a soprano, I'm singing like a contralto, like an alto, like a heavy metal, because they are heavier in the structure of the vocal cord. In the structure of the vocal cords. This is another example in the subacute findings of the filter for example, the nasal cavity. We can see rhinitis and sinusitis in a maintained inflammation of the nasal cavities, for example, like in this example. There's a purulent discharge that is related to an acute infection that now is having an invasion of bacteria. And of course, this is a situation where we have more trouble for a prolonged time, a more prolonged time. And this is another example of a very important baritone, classical singer baritone of our country. And he was inside the hospital for more than 30 days, and 15 days of which inside the intensive care unit because of 60% involvement of the lungs. And this is the picture after 3 days of rehearsal for a concert, after 2 months of the hospital discharge. And he told me he was doing everything equal to before the situation before the infection, but he could feel that the voice was very worse and with breaks. And what we saw is this small hematoma showing a little bit reabsorption at the left vocal cord. So you can see that there is difference in the color, a green area here, and a small hematoma, and that's why he had this change in the voice. Of course, probably related to unconditioning, deconditioning of the muscular breath support, and of course also because of a lack of an atrophy of some muscles in the glottal area or the larynx. And this is another thing that we can see in the subacute findings of the source. This patient was submitted to a 10-day intubation in the intensive care unit because of coronavirus. And after 3 months of the hospital discharge delivery, she could feel that there was a sound, very rude sound related to inspiration. There is a stridor. So you see that there is no complete abduction of the vocal cords because of a probable stenosis and cicatricial scar tissue formation in between the inner part of the posterior part of the larynx. You can see this is the phonation, and this is the breathing. This is the phonation, and this is the breathing. So she could not open the glottis because of this inflammation. And in summary, we can say that COVID-19 consequences may continue to interfere in the artistic voice after days or months, even when the patients are totally cured. One bit and very important trick is to treat the inflammation level and degree of the vocal tract and the filter and the source, and also the biomechanical voice restrictions. Biomechanical voice restrictions using voice therapy, logopedists therapy, and the inflammation level and degree by treating the rhinitis involved in the post-COVID era, and also the chronic and subachic infections that take part in the sinus in many instances, and also to retrain the voice. I'm so happy to finish this presentation, and I'm really happy to be here to answer the questions. See.
Thank you very much, Dr. Reynaldo Yasaki. This is very interesting how we are dealing with COVID-19 in this era. Of course, 1 year, 10 months, we have more experience than before. So now I am going to present Dr. and Professor Dr. Nicholas Gibbons. If I may have the presentation, please. He's going to talk about direct and indirect effects on the artistic voice. I would like to welcome also our dear treasurer, Dr. Philippe de Joncker, and also our Lieber Tadeusz Nauka from Berlin, and Philippe from Brussels. Thank you, and Carlos from Mexico. Thank you very much for being here with us. So we shall read a little bit about Professor Dr. Nicholas Gibbons. He's clinical director for ENT at the University Hospital of Lewisham in London, with a very special interest in voice and the head and neck. He's faculty member of multiple national and international courses and conferences, and he joined for the votation from Collegium Medicorum Theatri this year, so it's a great pleasure to have him here with CoMet family. He has also many publications in international and national scientific magazines, and he's a collaborator in book chapters from this specialty. His also expertise in this diagnosis of voice pathology, blue light technology, the management of the professional voice user, world lead in the effect of body biomechanics, because he's also a very steady and has a lot of experience because he has been running marathons and ultra marathons. So he's a wonderful sportler also. And their effect on the voice and the management of this body biomechanics, he has made a lot of research. Also, he's interested in cancer diagnosis, advisor of the Royal Opera House and the Royal Academy of Music and the Royal College of Music in England. He has different scientific and sports awards, like Van Lawrence Prize from the British Voice Association in 2016. He is also the owner of this David Howard, our dear friend David Howard from British Laryngological Association in 2017. At the moment, he is vice president of the European Laryngological Society, and he had organized the biennial meeting in London from this European Laryngological Society, and he also was organizing the virtual meeting on July 2020. He will have the new CEORL HNS meeting in Milan in next year. He's a representative from the British Laryngological Association for British Academic Conference in Otolaryngology and the European Laryngological Society. He's a honorary secretary of the Hunterian Society since 2016. This is a great activity that he's making because he has been organizing many larynges skeletons. And he's also members of the Needles Medical History Society with these laryngeal models. I welcome Dr. Nicholas Gibbons. Unfortunately, he's not going to be here with us with the live discussion, as he says. So we shall hear the video now.
Ladies and gentlemen, colleagues, Madam President, thank you very much for the invitation to come and speak to you today. I just apologise I cannot be there in person as I'm currently examining at the European Board exams for ENT, and it's an all-day thing. Such is life. But it's a great pleasure to be here, and thank you. My name is Nick Gibbons. I am a laryngologist and head and neck surgeon based in South London. I lead the largest consultant-led voice clinic in the United Kingdom with more than 8,000 patient hits over the last 10 years. And we also have the largest voice clinic for paediatric population in the UK, including a lot of the choristers that you might hear and the Christmas carols and so on. We have a high number of professional singers coming through the clinic, partly due to being surrounded by a lot of musical theatre colleges. So we see a lot in the sort of 16 to 21 age group, but also we have, being in London, a lot of the West End rock, pop stars, and I see a very interesting cross-section of the singing society. With that in mind, I just do a little timeline for what happened with COVID in the UK, because this is about COVID and the artist. Each country will have their own timeline, but I'm sure you'll see a lot of similarities from whichever country you were in during this time. Now, in March of 2020, we had our first national lockdown, and we went into complete shutdown. Nothing happened. Everything stopped. All art stopped. I was lucky I was able to go to work every day. I had to fully PPE myself with masks and gowns and all the rest of it, but I was able to leave the house and go to work, and I was one of the very few. Towards June, this started easing off, but then the second wave came along. We had a second national lockdown at the end of October last year. That eased, but just before Christmas, the country was divided into different areas, and you could have local lockdowns. And unfortunately for us in London and in southeast England, we went into tier 4 just before Christmas, which means Christmas was pretty much cancelled. So we're in our houses on our own. We made the most of it. In January, however, it gradually got worse, in January of this year, and we went into our third complete national lockdown, working from home. In March, the lockdown ended, and there have been a graduated return to normality. That is for, first of all, essential sort of healthcare workers and so on, and then more and more of the inverted commas non-essential workforce. However, artists and singers are not in that group, and they have really struggled. We are currently in the middle of the third wave, and it's a much smaller wave. As an example, in our hospital trust at the peak of the second wave, we had 550 patients with COVID, and currently we're running at about 40, and it's slowly coming down, which is great, and hopefully that will continue to reduce. Numbers are gradually creeping up again, but we have a very high percentage of doubly vaccinated people in the population, and currently the health services are currently not being overwhelmed. However, if we go back to the beginning with the artists especially, and the reason why the choirs certainly in the UK have not come back so quickly is because of a few instances in different countries to do with choirs, and I'm sure you'll be well aware of these. In Amsterdam, all around the same time in March, first half of March, 100 choristers out of 130 fell. A 78-year-old singer died. 3 partners of singers died, and there were multiple intensive care admissions after a practice. In Berlin, a cathedral choir that almost just the day before they had a practice. 30 were severely ill, 30 ended up with milder symptoms. And that was at a time when there were less than 50 reported cases in Berlin at the time. So this was really coming in under the radar, and it shocked a lot of people. This is, I think, the one that really set the ball rolling in terms of public and perhaps governmental response to choirs, especially. It was the Skagit Valley Chorale in Washington, United States. Rehearsal on the same day, March 10th. COVID was spreading fast, but up the road they hadn't had any reported cases at the time. And the conductor said, look, this is the situation. We'll try and make it as safe as possible. We haven't got any reported cases. Who wanted to turn up? And about half the members did turn up for practice. After 3 weeks, 45 were positive and 2 died. So this was, and that really, on the background of them being asymptomatic, was a real worry, and everything shut fairly quickly. There was also, at the same time, a Saint Didier Mont d'Or indoor choir practice. I think they were all men, actually, 27 people, 25 singers. And as you can see, a number hospitalized, a number were positive, a number ended up on ICU. All a bit scary at the time when we didn't really know quite whether this was going to be the end of the world or not. And unsurprisingly, choirs especially got shut down very quickly. And the current situation, this was a headline in the Guardian newspaper in the UK, as you might just be able to see there, on Tuesday the 19th of October, just very recently. And it's been estimated that more than a third of the UK music industry have lost their jobs over the last year. Choirs have only come back since the middle of 2021, initially non-professional and with a rule of 6, and you had to be distanced, and gradually that has reduced. The West End has really started up and running at the beginning of September, end of August, beginning of September, and in fact I went to see Hamilton, which was at the Victoria Theatre, which was brilliant. But suddenly you realise you've got used to being spaced, and you're in a theatre and everyone's squashed together, and there are a lot of people on stage. So it's an interesting return. So that's the background. We're still trying to get back to full artistic work. But what actually happens with the direct effects from COVID-19? Well, we know that COVID, the virus itself, doesn't cause an awful lot of issues. It's the triggering of the inflammatory response via the ACE2 receptors with massive cytokine storm and inflammation that causes this serious illness. Often people, if they're on intensive care for weeks, are completely devoid of virus a few weeks after admission, but they're still incredibly unwell because of the inflammatory response. The ACE2 receptors are throughout the body, especially in the basement membrane of the lungs, hence the breathing issues, but also in the cardiac joints, in the gut, in the kidneys, and the cytokine storm can trigger things like vagal neuropathies. More recent studies that I'll come on to have shown some ACE2 receptors in the larynx and the upper air digestive tract, giving us some symptoms then. And then also we are now getting more long COVID effects as well. So in terms of direct effects in the larynx, I've divided them into generally structural, and therefore they're going to be people who have been seriously unwell. They're going to be intubated, they're going to have tracheostomies, they're going to have some sort of surgery done. But you can get a lot of quite serious issues there, and you're really going to struggle to sing or anything. You could still be a musician without being a singer, but you're going to have those issues addressed. Then also the functional side, and I've put this generally under the post-viral vagal neuropathy umbrella, because you get palsies, paresis, partial movements, discoordination of the vocal folds, a reduced vocal fold closure quotient, because the movements of the vocal folds are not symmetrical and coordinated, and even there have been reports of paradoxical vocal fold movements as well. And I think a lot of some of the inflammatory stuff in and around the larynx is because of the ACE2 receptors that have been seen in the larynx, and this was a study by Descamps et al. In August of 2020, published in August of 2020, and you might just be able to see here. This is in the vocal fold. These are all various areas in the upper head and upper airodigestive tract, and we've got increased numbers, or higher than normal numbers, in both the larynx, but especially in the vocal fold. And this may be an indication as to why some of the inflammatory effects affecting the vocal folds specifically. What we have here is some intraoperative photos of some quite subtle scarring on both vocal folds. On the right vocal fold, you might be able to see, just in this area, a depressed region where the epithelium has been retracted laterally, and on the left hand side, a much more obvious linear scar, which I was able to resect. You might just be able to see this thin lateral scar here, a longitudinal scar here, which I was able to resect and replace and fill the gap in the superficial lamina propria with a lot of Merigel with some steroids to try and prevent it sticking down again. She actually got a pretty good result with that. I was very pleased. This is a video from my colleague, Mr. Yakubu Karagama, who works at Guy's, and he is part of an MDT for a long COVID squealy type clinic, and he is also a laryngologist. And this is a picture, a video of a postglottic, and this is the vocal folds are here and here, and postglottic scarring with both an abscess in and around the cricoid, which then heals with scarring, and the vocal folds become fixed. Now he ended up using a laser, KTP laser, a blue light laser, trying to dilate it, not working. This is all speeded up, but there is a lovely balloon dilatation, and he's managed to get some movement back, and the arytenoids are opening, and this is down into the airway whilst awake, and you can see the subglottic normality in the distance and the subglottic irritation and inflammation much closer. Now, this is a patient of mine who isn't actually post-COVID, but I've seen this in post-COVID, which is a bilateral vocal fold palsy, or so it would have seemed. It was actually bilateral arytenoid fixation due to an intubation. And what you'll be able to see here on a flexible endoscopy, you can see mucus pooling in the hypopharynx, so the swallow is not very efficient. And then when she sits E, which should be in a second, you can see very little movement at all. Now, what I'm going to do is move on, if I can. Now on the bottom right hand corner, you'll see another patient who has had a post-intubation injury. Now in the posterior third of the left vocal fold, sorry I can't quite stop me on the video, but there is scarring here, and that is because when intubating, the tube goes from the right hand side of the mouth across the hypopharynx and through the glottis in the direction of the left vocal fold, which means that if there is going to be any scarring or any direct trauma from the iatrogenic injury, it will be on that left hand side. Now that lady who you just saw ended up having an injection and then followed by actually a minimal thyroplasty, and it got an excellent result, just needed to close that gap. So the outcomes from COVID. People with COVID have been in hospital. Regan et al. In October 2021 looked at 315 patients across the Republic of Ireland, and a quarter of them were discharged with dysphonia, but it wasn't classified as to what type. Annie et al. Came up with a very similar number of patients discharged from their hospital in Iraq, and like Leshian et al. Really were the first people to come up with is this a direct or indirect symptom? Because could it be an increase in laryngopharyngeal reflux, a massive stress response? Of course. They'll probably be using a lot of inhaled corticosteroids. There'll be an increase in postnasal drip, and Assam et al. Has shown a link between increased postnasal drip and dysphonia. So there are a number of different issues there, and the debate is ongoing. With regards to indirect effects on the larynx, there are, of course, respiratory, on the voice especially, and I'm concentrating on the singers, but reduced airflow with lung fibrosis, muscle weakness, fatigue. With the gastric symptoms, we're talking about a profound cough giving you increase in reflux. And although there is no evidence in the literature yet, anecdotally from our speech therapists in Lewisham, we're seeing a very high percentage of post-COVID with reflux that needs treating, even if it's just with non-medical but with lifestyle measures to try and get that under control. Increase in sinonasal symptoms with dryness, but also an increase of inflammatory postnasal drip irritating the hypopharynx and larynx is present. Long COVID, I will briefly mention: cough, lung fibrosis, fatigue, dryness, and the most important thing of all of this is the psychological aspects of COVID, both of COVID as a chronic disease without being able to see the light at the end of the tunnel, but also with the mental health issues surrounding isolation, the lockdown, loneliness, and with our artists, it's the loss of income and the financial insecurity will play a massive part in their overall well-being. So in summary, we talked about the direct and indirect consequences of COVID on the larynx and some systemic issues, including the psychological issues. And with that, I will wrap it up and say thank you very much for the invitation to come and speak. I wish I would be able to take questions from you, but I would be very happy to get into any conversation via email here. I thank you all, and I hope you have a good rest of the day.
Thank you very much, Professor Dr. Nicholas Gibbons. This is a great pleasure. Your presentation was wonderful also. And now we shall hear our dear friend, Professor William Riley from the United States. He is going to talk about artistic voice and pandemic. And as we know, Professor William Riley is a baritone, world-renowned voice trainer, and award-winning classical singer, a stage director, a minister of music, writer, and a teacher of vocal technique to hundreds of elite performers over a decades-long career in world-class musical performance. And he is a voting member of the National Academy of Recording Arts and Science, that means the Grammy Awards. Professor Riley has been a long-term consultant to the medical profession within the expanding world of the care at the elite performer's voice. He has collaborated with his mentors, Dr. Fan Lawrence in Houston, Dr. Wilbur James Gould in New York. Also, he was contributing to the Denver Center of the Performing Arts and the National Institute of Health. He has been a consultant or served faculties on the Voice Foundation Symposium, the American Academy of Otolaryngology, Actors Studio, New School, University, Westminster Choir College, and he has also worked as a consultant with Voice to Graduate the Voice Center in Mount Sinai Hospital in New York, in Lenox Hill Hospital, and the Royal Medical Hospital in Amman, Jordan, with the White House, and of course the Metropolitan Opera. He has doctoral studies in vocal pedagogy in the University of Illinois at Urbana-Champaign-Urbana. He has a Master of Music, and he also has studied voice performance at the University of Illinois. Also, his Bachelor of Music 1974, and also he has a voice performance degree at the Southern Methodist University at Dallas, Texas. Awarded, he has this is very special awarded by Gustav Abel. Gustav Abel is the president of the Brahms Gesellschaft, and the professor really studied Brahms and Schumann literature in Baden-Baden, and he has studied the personal letters and the heritage of the music in the home of Robert and Clara Vick Schumann. Thank you very much, Bill, to be here. And as dear Collegium Medicorum Theatri, now we shall see your video. Before.
Good afternoon, ladies and gentlemen. It's a pleasure meeting with you today at the CoMet here in the late fall month of October. It's a pleasure being here, and thank you again for Dr. Eugenia Chavez for inviting me. Today, my topic is going to be the pandemic, the end of performing arts, or a new beginning. My name is William Riley. I have a private practice in New York, and in Rye, New Hampshire. So the question, can performing arts and musical performance survive a pandemic? As the pandemic flourished, the shutdown of theaters and schools meant that young artists could no longer attend their private lessons or rehearsals. In the case of performers who were employed, they lost their income and couldn't afford to pay for private lessons. Rehearsals over Zoom initially were chaotic. Latency was related to distance. If they were very far away, the latency was very difficult to handle. If they were in the next block, it was so much easier, but most latency was a long delay. Some participants would experience as little as 500 milliseconds, whereas others had a full 1.5 second delay. Accompanists in the private music studio could only approximate the feeling of accurate ensemble. It was very frustrating. Jamming musicians in pop music could not harmonize or improvise accurately. It was very frustrating, and most of them gave up. An unforeseen byproduct of the pandemic is a widespread psychological dysfunction. Students and musicians alike began to report symptoms that sounded like PTSD. Lack of sleep, cramped living quarters, inability to concentrate, cabin fever, all kinds of things cropped up, some reported by the student or by the client, and some not reported, but simply acted out upon. Anger, confusion, depression were commonplace, and people were reluctant to go outside to see a physician to have treatment. Possible solutions for these? Well, in universities and colleges, our whole scenario changed. Distance classes were instituted via Zoom, FaceTime, WhatsApp, WeChat, anything else that they could use that would be able to get the students to be able to participate in classes through the distance. Some classes would meet in a hybrid setting. Some students in a certain class would meet on campus. Other students in the very same class would attend remotely. This was very frustrating sometimes. Instead of rehearsals, some ensembles chose to create recordings with individuals using metronome applications and reassembling the ensemble by recording at a central site or a server, on campus, off campus, across town, maybe even across the country. Jamming hardware and jamming software platforms became a central element for some performers and for some universities. One that was very prominent on the West Coast was Jack Trip. It was a hardware platform that was developed by Stanford University about 10 years ago. It was very, very narrowly subscribed to. Very few people knew about it, but with the pandemic, we were all searching for answers to our problems. Another one that was coming up in the EU was SoundJack. Boston University established a small server farm for people in the US to use this technology. So Jamulus software was another one that was a software-based product, but not as easy to operate. However, it was much more complex software. As we went on to looking at applied music within the university and applied music in the private studio, like mine in New York City, teachers and students quickly would adapt, but they would often set goals to lower expectations than they had before. I found many of my colleagues were simply not requiring as much repertoire. They were simply not requiring as much accuracy, and little things like perfect intonation were no longer the most important thing. Really motivating them to become more musical and wanting to do the music became the central tenet of most applied music teaching. Applied music, by the way, is private lessons taught within the university or taught within the private studio situation. Private studios and workshops during this time ceased to function because of the lockdowns. Some have not recovered. 2 years ago, there were well over 2,000 private voice teachers in New York City. Today, I would say that less than 500 of them are actually functioning and making a living at this. few have reopened, drastically reduced audiences for social distancing in the theaters. Most theater owners refuse to allow productions for reduced crowds simply because the producers cannot pay the rent with reduced crowds. These large theaters, really, it's all about the cost of real estate. Hybrid classes in universities began reporting that they would progress more slowly in hybrid classes than those that were actually in the classroom. Frustration mounted especially among the remotely trained music students. So the jamming solutions became one of the best choices, but there were a little bit of a problem. The advantages with jamming software and jamming hardware is that we had minimal latency. Compared to Zoom or FaceTime, the latency was less than 100 milliseconds, which was hardly noticeable. But the disadvantages are it was too expensive to use in classroom settings because every workstation for every performer cost money, as much as $300 per student. That's not insignificant. Complexities were also sometimes beyond the computer skills of most of the participants, whether they were private musicians working in the marketplace or whether they were students in a university setting. There were not always the right resources to help them understand the technology. One other thing is that it required high-speed internet with dedicated Ethernet cabling, and workstations would require a dedicated computer with no multitasking allowed. One could use a Windows computer or a Mac computer or even a Linux computer, but no other programs could be running at the same time on that computer. So distance recording came out of this jamming software, and other technologies that have been in use for many, many years, like ISDN telephone lines, were suddenly coming back into fashion again. So the advantage to distance recording is it's much less expensive than having recording studios or traveling to the recording studios. Most participants in the distance recording already owned a smartphone, a tablet, or a PC. The disadvantages, it's time consuming to engineer the final product, very time consuming. In the case of the Metropolitan Opera Gala that was done online, some of the performers would sing a cappella in their apartments, whether it's in New York or Sofia, Bulgaria, but that grand ensemble of Va Pensiero with the full chorus and the full orchestra of the Metropolitan Opera took 2 weeks working 24 hours a day to concatenate and make sure all of the recording was working. It was over 300 participants in that lovely choral scene, and all of that had to be engineered by a small army of engineers. Rather expensive. Within the pandemic, there were many unforeseen problems. The things we didn't expect to see was unexpected early retirements of professors, conductors, and stage directors. Large numbers of university students were choosing to stay out of school. University libraries and municipal libraries rarely are reopening even today. And young learners must use primarily online study resources. That's very different than going to the library in a university and finding what you need. Collaborations between students, student to student, especially in small impromptu ensembles, drastically reduced. Artistic development in general in performance venues, live performances stopped altogether. Open mic venues today still remain mostly closed. Sheet music websites became the source for most people to find their sheet music. Some people would actually order them, but the orders would take much longer to arrive than they did in the past. Some professionals did have personal libraries of repertoire and recordings, but we began to see also a proliferation of students learning by listening to YouTube videos, which in the past we told them never to do because we didn't want them to sound just like somebody else. However, in the absence of one-to-one training, the YouTube scene was the one that many of them went to. Distance coaching is now becoming the new normal. We must call this an unforeseen success, because years ago, only 3 or 4 years ago, I would never consider starting a distance relationship with a private client without having them have an initial evaluation in person first. However, in the last year, to keep my work going and to keep the students that would like to come to me, I have changed my plan. I now will take many people from many parts of the world. I have people that see me regularly from Asia, from Africa, from Europe, and from Canada, all over America as well. And I no longer require that initial session to be hands-on because literally my hands cannot cross through those wires. But still, we are doing the best we can. Distance rehearsal consults are also more frequently pursued. Just today, Dr. Linda Carroll, my wife, and I did a consult with a recording session that was going on in Prague with a very famous Swiss mezzo-soprano. We were on the line for, I guess, about 2 hours. Worked very, very well. Dr. Carroll corrects me, it was 4 to 5 hours. But through the miracle of FaceTime or WeChat, we can now do those things rather easily with a very high level of quality. The orchestra had sent us a link. We go to a URL. We hear the live feed as it is being recorded with very little latency. And then we have a chance to talk back and forth on our cell phone with this little FaceTime app. It's amazing. The recording industry is now using this high quality distant feed for actual tracking and mixing over long distances. World-class broadcasts are becoming more important than live performances. That's a major change in today's culture. In conclusion, the changes that we have seen were not expected. The pandemic was not expected. We all thought that everything was going to stop. It would be over in a flash, but in fact, it is not over in a flash. Most music businesses and theatrical businesses have closed. They're barely beginning to start up again. My own teaching has changed dramatically. I've sold my business in New York City and I live now in New Hampshire. I go back to New York City a couple of times a month to do my practice in a rented studio. Very different way of doing work, but it is the necessity of the times. The times, they are a changing. Thank you very much.
Thank you very much, dear Bill. As we know, the world has changed and everybody of us have changed. Medical doctors, voice coaches, voice teachers, actors, singers, everybody has changed. And now we shall have The Future of Artistic Voice After COVID-19 Pandemia by Professor Dr. Ismail Koshak from Turkey. Professor Dr. Ismail Koshak is a medical doctor, otolaryngologist, specialized in voice disorders and vocology, but he's also biomedical engineer and also homeopath. This is a great, great mixture of knowledge. At present, he owns Dr. Voice Clinic that serves globally for professional voice patients and the one who needs voice care, of course. But also he owns Dr. Voice Techno As, a company producing and developing voice and bass technologies, including surgical devices and equipments. The technology team has performed successfully projects in voice technologies like the development of a voice-based platform called Vocify. He has origin as a musician and is still performing on stage as a vocalist and plays string instruments. He is specialized in professional voice and vocal performing arts medicine, and he is the voice doctor of Eurovision Turkish team. He has a master thesis in bioengineer of a model of laryngeal resonance and its use in improving voice quality through surgery. He has a special thesis in design of an implant for paralytic dysphonia. He has a degree in university trainee general surgery. He also trained there in Birmingham, 1991. He's medical doctor from the Faculty of Medicine of Hacettepe University in 1992 and specialty otorhinolaryngology in Ankara University in 1996. He was trained in microvascular surgery at Mount Sinai Hospital, and he also made his biomechanical engineer in Boyoyashi University 2002. He's associate professor of otolaryngology in Yeditepe University since 2010, and at the moment also he's a professor and chairman of otolaryngology in Okan University. His patent, for example, a portable instrument for the diagnosis and treatment of functional voice disorders, was made with also a team of Canada. I thank you very much, Professor Dr. Ismail Koshak, and let's hear you what you have to tell us about this COVID-19 and the future of the artistic voice.
Recording in progress.
Hello, dear CoMet members. This is my first talk in the CoMet meeting, and I'm very happy for that. Thank you very much for giving me such a privilege to make a speech to you. I think this is the last topic is about the future of artistic voice after COVID-19 pandemic. I think this is one of the most difficult ones because I need a lot of information for the future aspects. I try to gather them and I'll try to share them with you. As an otolaryngologist, we have a lot of patients, professional patients, who are either on stage or they are doing some recordings, and we follow them with their audience interactions, but we always see them organically, face to face, live, as a human being, their organs, their vocal folds, their ideas, minds, everything. So this pandemic came up with a thing that we should do our best in a virtual environment. So I think this is the main point. This virtual environment became a reality. And now we're not only focused on the organic interaction, but I think we'll most focus on their stage and studio interactions, maybe their audience interactions, and also the digital recordings, because most of the professionals try to do their job in the digital environments in their home studios. And they asked me a lot of questions whether they can do a better job, better recordings by some medicines, by boosting their techniques. So it became a challenge for us, and we had to do them virtually. So I think this is a great advance for us. And at the same time, we also dealt with the problem, the real problem, the COVID-19 cases. We had normal people and we had also the normal patients, and their routes of entry and their effects began in the otolaryngology regions, ENT regions. We not only see their lung problems, but also their anosmias, dizziness, hearing problems, etc. So we did a second job during the pandemic period. I don't want to go into details on them, but as a result, we had to understand what's going on in the voice area. And a lot of researches has been published, and we see that about 20 to 26% of laryngeal involvement with dysphonia was observed, and actually, although the vocal folds are reaching ACE2 receptors, but the COVID did not affect directly the larynx. In my examinations, I didn't see a direct laryngeal effect, but secondarily, when the lungs or pulmonary system is affected, the larynx is also affected. So the dysphonia became a bad prognosis for those cases. Therefore, the laryngeal effect was not the primary concern, but the other effects became most prominent and important for us. The second question came, and what about the restriction in the lung capacity? Did it affect the professional voice? In the acute cases, the acute phases of the disease, the professional tried to sing by preventing the coughing. and this resulted a functional dysphonia in the early cases, which is like muscle tension dysphonia type 2A, a glottic hyperadduction state. But almost all patients healed well, and no considerable restrictive pathology observed in the follow-ups. So therefore, we have cases and non-cases, and they all healed well. When we check the literature, we see that the voice results, the vocal changes or dysphonia was the result of the pulmonary involvement. Therefore, the larynx is not the primary site for it. After COVID-19, the patients were highly susceptible in the they were psychologically affected. We saw anxiety and depression. When we check the literature, we see that the mood disorders were related with the inflammatory cytokines, especially the interleukin 6, and it was normal. At the same time, in some cases, we saw arrhythmias and tachycardia and loss of confidence to establish the stage tests because they thought that they had permanent things stayed in their vocal organs. In some cases, smell and taste loss reduced their happinesses, and we saw in some cases sudden hearing loss. But them, the most important one was anxiety and depression, which was very effective on those professional cases. As we know, during the pandemic, the status was very bizarre. The cancellation of the professional activities were affected both psychologically and economically. They lost their hope for the entertainment business. We also lost our hopes. It was great anxiety. We had the fear of losing the vocal organs. So do us. So, like, also I felt the same thing. And we were all limited to the digital streaming technology. Worse or more than that, there were fake news, cyber crimes, and new ideas of cryptocurrency or NFTs. I think we will talk in the future such NFTs, voice NFTs or something like that, and lack of efficient voice-based digital platforms. We use Zoom or something like that, but their voice quality or it was not suitable for the professional activities or stage activities because they were limited in their latencies because latency was a problem. So live sessions were not possible. And most of the singers and professionals preferred to do recordings at their homes, in their home studios, and they sent their pre-recorded uh, products and shared them, like this one we do. So when we looked at the previous pandemics that happened in the world, there were four things thought to be happened. One, they accelerated the polarization in the society. They put sentiments of hate, xenophobia, social conflict, and division. I think this is culturally important because we had difficulties in getting our visas to the countries, so we didn't attend to the not only meetings but also the entertainment activities. And we were all talking about which country was in risk and which countries was not. So it affected, and I'm afraid that it may cause a xenophobia in the future, resulting these cultural activities, and that may be a difficult thing for all of us. So therefore, as doctors, we should be very aware of this one, and we should control this not psychologically, individually, but also socially. And there are statistics about that, and we see that e-commerce increased fivefold in the G8 countries. That happened several years ago in music industry, and there is a shift. They are expecting a shift in the occupations, and this is a very good um, chart. Says that some um, jobs are have will be decrease and some will increase, especially the occupation as an occupation category. The health aides, technology and care workers are increasing, are expected to increase within 10 years. And also the creative and arts management is going to increase. So therefore, I think this pandemic, after the pandemic, our jobs will increase in the amount, abundancy, and the quality. And we see that these kind of businesses will going to decrease within 10 years. So it's important that we should be well prepared for the future, for the entertainment business and the health industry, and we should improve ourselves and our technologies in all aspects. Before the pandemic, our approaches changed in the performances. For example, we used to deal with overuse and its problems, nodules, bleedings, and the hyperkinetic disorders. But this time, in the pandemic, we deal with the noise problems. Is it a problem? Yes, it's a problem because if you're not using, if you're not practicing or rehearsing, so you lose your talents and you lose the intellectual property. Therefore, it became a challenge for us to motivate our patients and professionals to do their jobs as much as possible. During that time, in our clinics in Istanbul, we observed and experienced some different things. First of all, although we cared the professionals, but also we cared the non-professionals, and the non-professionals liked to perform, and they found it good to get in the professional life, and they made productions. A non-professional became a professional during that time because they found out their hidden talents and they used them. So we have now new professionals. We adapted ourselves and techniques to the online management and treatment strategies. We mostly focused on the psychological issues because most of our patients came with their psychological problems because they don't have nodules or something like that, but they have psychology only. So we focused on the psychological issues. Therefore, we learned the yoga and other body disciplines and combined the techniques of self-body discipline, dance, myofascial massages, etc. Hopefully, observed no organic problems in our professionals due to COVID infection, except transient smell problems. Why was not possible to do live sessions, live um, um, performances? Because of the latency. You see the latency values of the um, cellular system, and the Starlink, now currently very popular. Human ear cannot perceive below 0.5 milliseconds, but these are very long latency periods, so it is hard to do a live stage performance digitally online. Therefore, currently we should wait a better solution for the online concerts. So as a prospect, we're I'm suggesting that remote work and virtual meetings are likely to continue after this COVID pandemic, and the technology will advance accordingly. And I think the improvements will focus on telemedicine and streaming entertainment, depending on the technology again, and it will have a potential to propel faster adaptation to automation and artificial intelligence. And we should manage vaccination protocols, and we should always think that art is the super vaccine. So we should keep art above them all. So we should accept the new colors, styles, and techniques. We should accept these changes, and we should learn the new artistic uses, especially the digital ones, because we are organics, but we should understand the digital use, and we should follow the trend lines, the response of the audience, and the response of the audience politics economics, and we should understand what is pleasant and what is unpleasant. So in the future, we should not focus not only the standards of ourselves but also follow the audience and the trenders expectations and the targets. And as a last word, art cannot change future, but it can change human beings and their perceptions, and they in turn can affect what happens. Thank you very much.
Thank you very much, Professor Dr. Ismail Goshak. So, as we see, art, science, technology are all these themes very important for our days. We didn't expect that, but we are here in the reality, and we have to keep on optimistically, but we have to keep on. So don't forget to write your questions. And I would like also to say hello to our Lieber Professor Dr. Wolfram Steiner from Berlin and our carissimo amico from Andrea Ricci Maccarini. They are also here with us today. So this is a pleasure to talk about to our Collegium Medicorum Theatri dear members for many, many, many years. And they are very well known in the voice world, in the laryngeal world, and in the science and art world of music. And I am talking about Dr. Marc Bouchaillet and Dr. Guy Cornu. So I remember when I met Professor Dr. Marc Bouchaillet once, and I was completely delighted with all the Lyonese school that Marc Bouchaillet and Guy Cornu founded for everybody. He was born in 1936 in Grenoble, France, graduated from ENT from the Faculty of Medicine of Lyon, wonderful city, in 1970, appointed associate professor of the hospital in 1970 in Paris. He had a practice, a private clinic in Lyon from 1970 with huge and wonderful activity in microsurgery, in otology, otoneurosurgery, and he began with Professor Dr. Guy Cornu phonosurgery with Guy as a partner in the same period. He was carrying out over 30 years of 4,300 phonosurgical operations for dysphonia linked exclusively to benign vocal fold lesions. I remember all the micro instruments that Marc Bouchaillet developed, We are still enjoying that. The participation in numerous workshops, surgical demonstrations, live surgery of all continents were enriched by Professor Marc Boucheyer and Professor Guy Cornu knowledge and experience. In addition, since 1980, he has organized 10 international courses in phonosurgery in his private clinic in Lyon, already by 1,200 specialists. So we are many of the CoMet members. We have been pupils of Marc Boucheyer and Guy Cornu. He honored with several international awards, Yale Prize in 1995 in Cairo, George Daven Howell's Memorial Prize in 1999 in London, the first Oscar Kleinsasser Prize of the International Laryngological Society in 2000 in Paris, and he has been international and national faculty for many of our conferences and our courses and workshops. He owns many publications and books and videos that we enjoy many years in benign voice pathology. He also has been a member of several international societies like British Voice Association, International Association of Logopedics and Phoniatrics, Collegium Medicorum Theatri, and German and Swiss ENT societies. He sees his medical activity, but not our friendship, dear Mark, since January 2001. And it's a pleasure for me to give a big applause. And I don't know, dear Mark, if you would like to say some words, because you have also many dear written greetings from Anton Jovan and Orietta Calzinoni, and from many, Robert Satalov and Piku from the States, many dear CoMet members that wanted to say hello to you, but due to different schedules and things, they say to you, we love you, dear Mark. Do you want to say something, dear Marc Boucheyer, with us today? Well, we keep on with Marc Boucheyer. You are here. Okay, please.
I try to do some words. Do you understand me?
Perfectly, dear Marc.
Perfectly, yes. So first, I would like to thank you very much for this wonderful commit session you had organized, and especially to give to us, me and Guy, this wonderful promotion as honored members of the CoMet. We cannot be here. We are too far from you now. And also, I would like to thank very much Romain Perouse and Bruno Colombo for their wonderful and very friendly message they have given to us at the beginning of the session. It was a great surprise for us. Thank you. And I say my best wishes to all the members of the CoMet. I know, I see some of them on the pictures, and it's very important for me, this session. Thank you very much, Regina. Thank you again.
We thank you, dear Marc.
I love you.
Oh yes, we love you too, all, and we thank you for so many years of knowledge, experience, and very hard work that you have done through all these years. And this is a very humble tribute for you, dear Marc. Thank you for being here with us.
Thanks again. Bye bye, and see you possible in the next year. I hope so.
Yes, thank you.
Bye bye.
And now it is also a great pleasure for me to
Dear colleagues,
to make a humble tribute also to our dear Professor Dr. Guy Cornu, because when I was in Lyon, it was something very special that happened. It was like something that make the world change, and it was when New York was terrified by the airplanes in these twin towers. So I was flying to Lyon, and we had a wonderful time with Professor Guy Cornu and Bruno Colombo and Roman Perus. That Bruno, as you know, is also CoMet member, and I am waiting for Roman next year to become also Collegium Medicorum Theatri member. And I was very happy because Guy Cornu was also playing because he's an instrumentalist, and his professional activities, his doctor in medicine 1958, with specialization in ENT 1961, and proficiency in phoniatrics 1973. His professional activities began with hospital functions as an assistant doctor of the Regional Hospital of Lyon, responsible for the Department of Phoniatrics in Otorhinolaryngology and Audiophonology Clinic at the Faculty of Medicine of Lyon. Teaching functions, lecturer, speech therapy school in the same university, but also he was a lecturer and professor in Faculty of Musicology and at the National Conservatory of Music of Lyon. He had with Professor Dr. Marc Bouchayer a private consultation, and they were a very wonderful team of medical doctors professionals. He was also Congress organizer for the International Course of Phonosurgery in collaboration with Professor Dr. Marc Bouchayer, and they gave, as I said before, many courses in the Polyclinique de Mungé, and also he had a colloquium, means of investigation of and pedagogic of the song voice, organized at the National Conservatory of all the region in Lyon in 2001. He has been member of numerous scientific societies: Société Française de Harlem, Société Française de Phoniatrie, Société Internationale de Logopédie et de Phoniatrie, Collegium Medicorum Theatri, and he is retired since 2000. And I also want to say that he and also Marc Bouchayer, they were authors for respiratory mechanism in speech and song in the voice, the phonosurgery of benign lesions of vocal cord. We remember this manual video in collaboration with Mark. It was just wonderful to have this video. At that time, it was not so easy as nowadays, but make a great contribution of the knowledge of video stroboscopy, and also the diagnosis and therapeutic monitoring of dysphonia with this video manual. And also the English version, we had it in 1999, where they, Marc Bouchayer and Guy Cornu, had the George David Howell Prize from the University of London because of this wonderful collective work. So the video stroboscopic atlas of the main benign laryngeal pathologies in DVD was one of the most wonderful experiences, to have all these samples all together and enjoy them, and of course look at them with another criterion and another clinical eye. Guy Cornu has also numerous scientific publications and published in the main national and international congress. But he also had many musical activities as director of the Ensemble Vocal of Lyon, which he founded in 1963, and of which he is still the principal conductor. He has notably conducted the great choral and orchestral works of Purcell, Bach, Handel, Mozart, Mendelssohn, Schumann, Fauré, Chevalier. Wonderful, Guy. I don't know, Guy, if you are connecting with us virtually, because I don't know, sometimes the schedules and the places are not proper. I don't know if you have some words, but I don't know if you are not at the moment, that you are enjoying our love to you, dear Guy, and also to your dear pupils, Romain Perus and Bruno Colombo. So I give you a big applause, Marc Bouchayer and Guy Cornu, and it has been a great pleasure to make this humble tribute to you as honorary members of Collegium Medicorum Theatri. Okay, now we are having our section of our new members. As we know, Collegium Medicorum Theatri has been growing through the selection of very expert personalities of the world. It is not possible if they have not have all many years in expertise, knowledge, and development of singing and acting voice in the world. That's why a Collegium Medicorum Theatri is very strict through the bylaws, only to accept through the votes and through the agreement of all Collegium Medicorum Theatri members to have accepted. And this time we shall share these small videos of her own presentation from Professor Soledad Saqueri de Argentina. Thank you, Soledad, for becoming a Collegium Medicorum Theatri member 2021.
Dear colleagues, before I start with the presentation of my professional career, I would like to thank all the members of CoMet for allowing me to be part of this family of prestigious and passionate experts on both science and art. My name is Soledad Saqueri, and I've been fascinated by the human voice since I was 8 years old. At that moment, I found out that singing was my dream. Throughout my career, I had the opportunity to learn from prestigious professors in my country and abroad, as the colossal Renata Tebaldi in Milan and Peter Elkus in New York. It's worth mentioning that Susanna Naidich, an honorable member of CoMet, play a key role in the development of both my professional and personal life. She has been my mentor, friend, and teacher for 34 years. I attended several courses on vocal technique, music, classical repertoire, and drama at the Institute of Advanced Arts Cologne Theatre. As a result, I had the opportunity to participate and perform at several TV shows and stages in Buenos Aires, among which is the famous Cologne Theatre. I felt that the voice was such a powerful tool that needed to be nurtured from different fields. That's why I graduated in speech and language pathology. Soon after, I started my journey as a university professor. I have been giving classes at well-known houses of study in Argentina and Chile on different subjects related to the voice for 23 years. Currently, I hold the chair of vocal technique at the University of Buenos Aires, positioned within the elite of worldwide higher education institutions in the music therapy course of studies. I also hold 2 chairs in actors vocal training at the Arts National University in the drama course of studies. I hold the chair of euphony at the University of Argentine Social Museum in the speech and language course of studies. I belong to the Professors Board at the Speech and Language PhD in the University of Argentine Social Museum. Last but not least, I'm a professor in a specialism course in communication coaching and vocal technique at the University of San Sebastián in Chile. On the one hand, I work evaluating and rehabilitating vocal disorders. On the other hand, I train and educate singers, actors, and professionals that make intensive use of the voice. My role as a professor encouraged me to write 2 books that were published by Acadia in 2012 and 2016 respectively. My first book was intended to be an invitation to analyze, discuss, and interchange opinions on scientific and artistic theories on the singing voice. I recently launched its 2nd edition, and it is titled Science in the Singing Art. My 2nd book is titled The Actor's Voice and focuses on a specific routine to develop the actor's voice from a comprehensive perspective. This year, I am working on my 3rd book titled Holistic Singing Learning System with great enthusiasm. This book is special because it includes an innovative app that allows singers to train their voices completely. This app is backed by the theoretical and practical support needed to understand acoustic and physiological fundamentals behind the magic of the voice. Last year, I had the privilege to be appointed as a president of the Argentine Society of the Voice, created in 2000 by our beloved colleagues and friends Iris Rodriguez and Susana Naidich. The Argentine Society of the Voice gathers physics, physicians, speech and language therapists, singers, actors, and professionals interested in voice science and art. I firmly believe that when knowledge is shared, it allows us to enrich ourselves and become more powerful. Becoming a member of such an honorable institution as CoMet, integrated by professionals I deeply admire, fills me with joy and pride. I look forward to contributing my enthusiasm, experience as a professor, and as a speech and language therapist to this extraordinary journey of exploration of the human voice.
Thank you very much, Soledad. You are very welcome. And as you know, the Collegium Medicum Theatri members are selected by all our community due to their professional experience in artistic voice, singing and theater voice. Now we are having our next presenter. This is Professor Dr. Alfonso Borragan Torre from Santander, Spain, and this is a great personality, and I am very proud to welcome him as a new member 2021.
I like my dedication to my field of medicine, which has been of over 40 years. I am afraid to say I have not been able to devote as much time to English, and as a consequence, I occasionally have difficulties in answering and expressing myself. Now that I have got that off my chest, allow me to introduce myself. I am Alfonso Borragan. I was born in Santander, North Spain, in 1957. I studied at the Faculty of Medicine in Santander and qualified as a doctor in 1981. Trained in ENT with Dr. Diaz Gomez for 3 years. My interest in communication disorders took me to Italy, where I spent the years 1984 to 1987 at the Phoniatrics and Speech Therapy Department of the Hospital of Padua with Professor Croato. I went to Italy with my wife Maria and one child and returned with another, along with a suitcase full of knowledge and a huge desire to research. I set up the clinic in Santander. On my arrival, I have worked there ever since. We have seen over 13,000 patients with all kinds of communication disorders, but I have always had a soft spot for voice pathology. I have also worked as a teacher at the School of Performing Arts at the Festival Theatre in Santander, and it's go to phoniatrism. Thanks to this, I have had the privilege to teach voice physiology and especially to apply it to the students and patients who come to the phoniatric and speech therapy center I run. As the voice is part of the body, tension and stiffness pose great limitation. Here I would like to give you an example of the way we take the body to its maximum distension.
Questa stanza non ha più pareti, ma alberi, alberi infiniti. Quando sei qui vicino a me, questo soffitto viola non esiste più. Io vedo il cielo sopra noi.
Benissimo.
Adesso ho capito.
Hai capito.
It is not unusual to see my students leaping from chair to chair as they seek to discover and boost their voices. They have never forgotten such moments. Our team of phoniatricians and speech therapists are continually researching, and we aim to reduce treatment time and to improve efficiency. By studying the physiology, we realize that water, i.e. the direct hydration of the vocal fold, had incredible effects on the voice and vocal dynamics. The following video demonstrates how the dynamics of the mucosal wave of an actor can be transformed after 10 minutes of breathing through a dumb ghost with speaking or singing at the same time. We have published an article about our experience of over 20 years in this area with our Italian team, Andrea Ricci Maccarini and Marco Fantini. We are enthusiastic researchers, and above all, we have fun and like our patients to enjoy their treatment. We have the clear impression that people who get to know us will not forget us.
Well, has been a wonderful session. I thank everybody of you of sharing your wonderful knowledge, of accepting the reality that we have now. Now our reality is different that when I was in 2019, when we were planning our Collegium Medicorum Theatri with John Rubin and Ruth in England. We were going to have a wonderful meeting in presence there, and then we had to change. But we have now another tools, and as exactly William Rayleigh say, well, we have to adapt ourselves to the new world, and the new world is different. So it was not possible in 2019 to see all of you together in very tiny and small pictures. But anyway, we are talking, we are having some greetings and hugs from very, very far away from our countries. So the reality is different, and I do enjoy very much that you can agree with us in CoMet board, Joseph Schlomicher, Adi Primo Fever, and of our dearest Philippe de Joncker, that we have to be close as a family. Of course, this is a very special family. Not everybody can belong to the family. I am sorry, but we have very strict criterions. That's why it is an honor to me, for me, to have honored our dear, dear Professor Marc Bouchaillet and Dr. Guy Cornu. But also, I thank you, all of you, to be here because it's a great party. It's a wonderful feast. Anyway, I want to remember that we are having several issues. First of all, we are having on 11 December our New Year Toast online celebration. I hope you can join us. It's going to be only 1 hour. It's not a big communication like today, but I would like very much to see a little bit of your faces and to have this celebration. Of course, it is unfortunately the same day that our dear Junior European Phoniatricians is having also face-to-face and virtual Congress. We are going to be there virtually, and many of us are going to be there in presence, face-to-face. But anyway, don't forget, our 10th session will be 8th January 2022. If you would like to share your knowledge or make some presentations, please let me know on time. We are going to discuss a very delicate issue, that is reflux and digestive system problems, and of course, in the artistic voice. Don't forget, we have a big program for open live discussion, of course, now in internet. We are having also on March our hearing pathologies and artistic voice. On May, we shall have behavioral issues and artistic voice users. And in July, our theme is pending, and I think we are going to speak a lot about rehabilitation and the modern age. And do not forget, our annual conference is going to be hopefully face to face or hybrid in Tel Aviv, Israel, with our dearest member secretary Adi Primafever and our dear ex membership secretary Ofer Amir. They are organizing that, and we hope we shall have a beautiful face to face and hybrid CoMet meeting in Tel Aviv next year. But anyway, I want to tell you something about what is happening now. We are going to have a CoMet session in Voce Artistica with our dearest CoMet member Franco Fusi and some other CoMet members. This is going to be in November. Also, the Union of European Phoniatricians with our dear CoMet member Ahmed Kenei, that sends many greetings to us today, but he was with another congress. He and of course the members of the UEP are organizing a wonderful hybrid congress, and I invite you all. We are taking part, some of us like me, online, but some face to face. And this is in our webpage. You can look at the times, and it's going to be wonderful. And our next session's contribution is very important from you. Please don't hesitate and let us know if you have some idea about if you want to present, if you want to make a roundtable or whatever. It is very important that we have, as CoMet members, your curriculum vitae for our webpage, your photos, and please do not hesitate to send your proposals for Tel Aviv if coronavirus allowed us to be face to face. If not, we shall think about something else. And do not forget that we need your contribution, your payment for 2022, and of course, sorry, this is the emotion of being again here with you. That's why I have some cough. And of course, do not forget to subscribe in YouTube channel. You can have there many of the wonderful sessions online that we have had. We have a very beautiful contribution of our Lieber Professor Jürgen Wendler that you can enjoy in our webpage. And also, please send all the information about the Congress in Tel Aviv if you want to have something special or not. And do not forget also that we have a special section for the Voice Foundation that we are going to upload now through the very nice contribution of our dear Bob Satalov, that is allowing us to have in CoMet webpage all the CoMet session that we had this year in Voice Foundation. Do not forget Voce Artistica with Franco Fusi. Do not forget Union of European Phoniatricians with Sanja and with Ahmed Kenei. And next year, we shall have many CoMet sessions. We hope all face to face. And do not forget that CoMet is a family, and as family, we have to be in all the places all over the world. And of course, your payment is, we are very grateful because we have some payments to do. So that's why we will thank you to pay the 70 euros for next year's and the Zoom sessions. Also, as closing remark, I thank you very much, Professor Dr. Marc Bouchaillet, Professor Dr. Guy Cornu, for all your love that you have invested in this wonderful human potent, the human voice in the artistic expressions. We thank you dearly for all what you have done for us, and all the COMET members can make this especially for you. And you receive many dear greetings from all the COMET members that could not join us, but you do know we love you dearly. And of course, I thank very much Professor Jürgen Wendler, who is going to give a very special presentation in the Union of European Phoniatricians in Belgrade. If you can go to Belgrade, you are going to enjoy that wonderfully. If you cannot go face to face, like me in Mexico, I cannot go through the coronavirus problems, and some countries allowed us, some countries not, or whatever. We can be virtually with all our dear friends, Sanja and her group, and of course, all the dear members of the Union of European Phoniatricians. So do not forget to share all the knowledge and experience with all this wonderful world. Now, virtually, we have many advantages to see all our dear faces, Alan, Reynaldo, Ismail, Mark Remakel, our dear Professor Wolfram Seidner, and our Cherie, Erky Bianco, William Rayleigh, Laura Ramos, Alfonso Borragan. So this is great to see all of you, and Soledad, Iris, Orieta, many of our dear Comet friends that are not here, but we know that they are here by heart. So I thank you very much for this wonderful session, COVID-19 and its future. Thank you very much, Professor Dr. Mark Rimakel. It was wonderful to have the Kandinsky unknown voice as a final of your glorious presentation. Thank you very much, Reynaldo. It was great to have all the details that you showed in your wonderful presentation. And of course, uh, our dearest Nick Givens, that is not here, but he has some issues in the professional examination in England, but he was giving a very nice presentation. And William Rayleigh, we thank you dearly because, as we know, you are dealing with all this new world as everybody is, but it is a special contribution that you made about the practical things that you announced today.
It's a new
And
world.
our new member, 2021, Professor Dr. Ismail Koshak, that has also many dear greetings from Ilter Denitsoglu, but Ilter was on the plane, and also from Haldun. But anyway, you are in Comet family now. And thank you very much for Professor Soledad, because she made a wonderful presentation, and she has been taking care of so many details through her life as a professional in artistic voice. And last but not least, our dear Spanish Professor Dr. Alfonso Borragan. I am so happy to session and to see all the wonderful group that you have in Saturday, Spain. So I thank you, all of you, and I invite you to stay with us in the live discussion. I know it's very long time, but as we discussed in the General Assembly last time in the great annual conference that we had, we are going to have a long session every 2 months. Every 2 months. So we wait for you in January, and don't forget to come to the toast and say hi with champagne, tequila, brandy, or whatever you want. But it is so great to see you, lieber Wolfram, dear Mark, dear Ismail, dear Reynaldo, dear Ana Gloria, dear Alan. Lieber Professor Jürgen Wendler, I love you. Dear William, mon chéri, qui vient encore. Gianna, ciao. Marc Bouchaillet, we love you. Je t'aime. Alfonso Borragan, te quiero. Soledad, te quiero. Andrea Ricci Macarini, tutto bene. Laura Ramos. So we shall stay in the live discussion. Thank you very much to be here. And gracias, thank you, merci, vielen Dank, grazie. So we are all together a very big family. And well, Ron Scherer is here. And I would like to see everybody in the small faces to enjoy your face-to-face presence, even though it is virtually. So I would like to ask Mark Remarkle about his experience now. Statistically, Mark, what do you think of the artistic performance in the future? What is your opinion after dealing with all these cases that you have to make surgery, that the examination from your side was difficult, that all medical doctors, we were very afraid of the aerosols? So which is your personal view, Mark, about the future of artistic voice?
Thank you very much for your question. I must say that the future will be great. I'm sure that we'll overcome this this pandemic quite soon, thanks to vaccination, and I have no doubt that it will become a kind of chronic infectious disease like the flu that we are used to have every year, with a regular annual vaccination. And when it will be under control, I think that the future of the artistic voice will be the same as it is now, and thanks to the teaching, the coaching, the care, it should be great. As pointed out by the other colleagues, for the basic singer or the trained singer who just don't have an infection, there's mainly a question of anxiety and stress. And I'm sure that with a few advices in the future, they will be under control. So in the long term, I'm not afraid. I'm more concerned about, fortunately, the proportion of singers is quite very low, according to the number of patients affected by a long-time intubation. But of course, when you have a real vocal fold injury from a long-time intubation, yes, we can improve them, but coming back to the previous stage, unfortunately, it's not possible. When you have a big scars or ankylosis, something like this, unfortunately, I think the game is over for the singing voice.
Yes, this is a very important comment, because in all the countries that we are in, we are dealing with different situations. And I don't know, in Luxembourg, where you are living now, Mark, if you have had some general recommendations for the artistic voice performers that are making, for example, streaming presentations. If you have had some acoustical recommendations, if you have made something about voice use or voice performance.
Well, we advise them, first of all, we all the population and of course singers are advised to be vaccinated, and then this is the regular case. In case of some of them have been affected and not so much affected that as pointed out, but like laryngitis, and then this is the usual care: voice rest, inhalation, anti-inflammatory devices. But beside this, as soon as the rehearsals were possible, they went back to the normal life. But during the COVID infection, the recommendation was the same as everywhere: small core, rehearsal, but not too long. If possible, discussion online. So this was the usual recommendation. But fortunately, no, the activities is really back to normal. You can go to the theater, you can go to the opera house, exactly as we were used to go. We just save some restriction for the sitting of the audience, but for the singers themselves, it's back to normal.
Thank you, Mark. I don't know if somebody from the audience wants to ask something to Professor Dr. Mark Rimatu about. Yes, Ron, your audio. Can you please open, Carla, please?
Yes,
Can
I'm
you please
trying, but the problem is that he didn't allow Zoom to access to
okay.
his audio. So
Can
I
you
don't
open
think that
yourself, dear Ron?
I don't think that he will be able to speak because he needed to allow it
Oh,
before.
can you allow that, Ron? Oh, okay. So we wait for you. And now I don't know if Bill, do you want to say something to Mark? Will really? Yes.
Congratulations, Mark. It was a very thorough
Thank
discussion.
you.
And I think that we're all facing those kinds of unexpected difficulties. And when we do have some injury to a professional singer, it's a very serious problem for them. Thank you and all the rest of the specialists for taking care of these patients and these clients and these friends of ours, because sometimes they feel alone without the care that they can get from the members of this organization. And we are all grateful for the work that all of you are doing.
Thank you for your comment, Bill.
Yes, Mark?
Yes?
You wanted to say something?
No. I just wanted to thank Bill for his comment.
Okay. Okay, Ron, are you ready?
Yeah, can you hear me now?
Wonderful. Yes, perfect.
Oh, well, that's too bad. I actually wanted to ask Bill what he does with singers with long COVID kinds of problems where they might be compromised in certain ways relative to lung function or otherwise, maybe not vocal fold tissue. But what do you do with those kinds of performers where they still have COVID aspects going on?
Well, you know, we see that singers are very special patients. They're not like the typical ENT patient. And because singers are such respiratory creatures, they get more exercise respiratorially. If they do their vocal exercises, they're going to get better faster. And we typically don't see a lot of professional singers that have long COVID. We do, however, see long COVID in terms of amateur choristers. Because they are not working as hard day in and day out as people that are trying to get back into their professional singing careers. So the people that I hear about that are experiencing long COVID are primarily choristers in amateur choirs and church choirs and school choruses, but not so much professional opera singers and professional choristers. Although we are seeing greater numbers of COVID infections among choral professional singers than we are among solo professional singers. So that is one of the things that is coming out of this new data, is that choristers, when they do go into live rehearsal situations, are at much greater risk of getting infection from their colleagues than professional soloists are, simply because of the proximity of the next singer. And so learning to use the singer's mask, there are a number of masks that are marketed for singers to use, has been helpful. A lot of professional singers are having difficulties with the rehearsal process because they are required in some states. The Santa Fe Opera, for instance, had a requirement that even though it is an outdoor theater, they could not have any rehearsals without masks. And the process of rehearsing in masks gives you a completely different self-awareness of pitch and the relationship of the balance between yourself and the orchestra. So my clients that were in the Santa Fe Opera this summer reported much more difficulty in the rehearsal process because of the COVID requirements of singing for many hours a day with masks on. But in other situations, specifically my clients in Europe are not having that same kind of requirement, and they're allowing them when they're on an open stage and the nearest orchestral person is a good 7 or 8 meters away, they're allowing them to sing without a mask. So we're seeing that there are social issues as well as medical issues. But I think the biggest thing we're seeing is the surprise is that choristers are at greater risk than soloists are.
Yes, which is your opinion, Mark, about this situation that we are talking about choirs?
Sorry, I didn't get your
Yes,
question.
about the choirs, because
Yes, exactly the same. It's a question of distance, as Bill said. That's why the recommendation, but it was not only in Luxembourg, it was all over the world, to have a small course or to be a little bit distant from the colleagues. But of course, from that you have a lack of efficiency. But yes, it was the price to pay. But
thank you. I would like to.
Yeah.
Thank you. I would like to ask Reynaldo, which is your experience with choirs? Mute. You are mute. On mute, yes.
Hi, thank you for the question. Here in Brazil, I take care of about half of our choral singers in our municipal theater, in our great theater for operas, and they have started to go back to the opera and to the concerts in the last 3 months, and they are performing tests weekly. And until today, I didn't hear anything about COVID infections in this process. I think that the infection here in the artistic population is very controlled, because they are all looking forward to have to get the vaccination. The artistic class is totally prone to have the vaccination, because this is the only way they have to go back to the stages and to go back to their works. And there's a financial problem that they're passing through. And I think that it's going to be solved and until our next carnival in February. We will open everything in next carnival in Brazil. And they went through quarantine until December, and then it started to open a little bit on January. But on March we had another wave, and they have to go back to the quarantine. And since September, they started, our musical theater started. And nowadays we're having the ensemble and choral singers and ensemble in the musical theaters in 6 great shows with more than 40 singers and performers in each one. About the infections in this period, I diagnosed and treated around 5. And when they come to me, these people, singers, these performers from the ensemble, they in the last 40 days, they came to me because of flu. That's the most important and common cause of consultation in my office. They came with sinusitis or adenoiditis causing acute laryngitis, taking them off the show.
But it was not COVID.
Not COVID. Yeah, they're tested. So when they come to me, I know that it's probably not COVID, because they are being tested twice a week.
And so, what about, sorry, Reynaldo.
Okay.
Okay. And I wanted to ask Professor Dr. Ismail, Which is your opinion about testing the singers, performers, for example, by choirs or soloists?
The testing is very important, I think.
Can you make it louder, please?
Yeah, please. Yeah. Can you hear me?
Uh-huh.
What about this? Okay. In Istanbul, the most of the activities in singing were cancelled until last month, and there is a film industry that are making serials, and it was very popular in the world now, so they continued their jobs. And during that time, they all had every day the lateral flow test, quick tests for COVID, and they had all vaccinations. And now the government made it. We are all vaccinated, all the singers and choirs and etc. So we are allowed to do our gathered meetings and activities. And now every day the tests are not performed every day, but every week period the tests are performed, the PCRs are performed.
Thank you, Ismail. And I want to ask Alfonso, which is your opinion about testing? Because, for example, in Mexico, mainly Mexico City or the big cities in Mexico Republic, we are testing, for example, the production that we have about opera production. We had to test every two days, rehearsals or performance. And which is your opinion, Alfonso? Your microphone. Micro.
I think, as Bill says, the world is changing, and now is a thing that it must be in our protocol. Many tests, new tests now in the future will be found and will be done, and this fact can change the rehearsal and can change all the performance. And the thing the most important thing is after this fact, perhaps the our and also the artists must be a little more bigger, a little more. His activity must be overload every day to be in a excellent performance. It's not perhaps with a normal training. Now we must think how they must do a bigger performance.
Thank you very much, Alfonso. And I wanted to ask Mark again, if you think that, of course, due to the situation of intubation, do you think it's a difficult question, but do you think it is not only the intubation, but also the reflux through all the stress that we are living in? Because in my daily practice, I was working all the pandemic. I didn't stop. Of course, I was very protected, but I think this is a multifactorial problem with intubation. It's not only intubation alone, but also the stress through the sickness, through the coronavirus in the gut and in the stomach. Which is your opinion, Mark?
Yes, I do agree. There's a lot of stress behind, mainly when they have to restart to speak or to teach or to sing. And of course, they have been intubated because they had a lung infection. So even if there is no injury directly at the level of the cause, a very poor lesions at the level of the cause, the lung function is disturbed. So it's also something that we have to deal with. They have to go to training to have a better breathing efficiency. So it's not only a question of vocal cords we have to take care of, but also lung function and irritation all along the airway. So, and by the intubation itself and by the stress, the reflux is certainly increased. Yes, this is obvious, this is part of the problem.
Yes, because this multifactorial situation for the artistic voice is not easy. Of course, we have different levels of problems. And I don't know, Will, if you have had some of your singers or your clients to have had this very long intubation, for example, 2 weeks intubation, and how did you find the voice after this long intubation? I don't know if you have these cases.
Well, because of my association with Dr. Gould at Lenox Hill Hospital, there were many professional singers that came to us for a number of reasons, often things like orthopedic surgeries that were long operations that might require continued intubation after the surgical procedure. So we saw in many cases in my days at Lenox Hill, people that were intubated for several days. And of course, there are tragic injuries where people are in automobile accidents where they remain intubated for weeks. Some of those are professional singers. Some of them recover, and some of them do not get their careers back. So it can be tragic for them if they are intubated for a very, very long time. But in the case of one very famous singer that came to Dr. Gould for help during this time was a famous Broadway performer, and he had developed through a long intubation after several automobile accidents, 2 serious ones and 1 minor one. He was intubated for a number of months, and Dr. Gould thought that he would not be able to get back to his career, but he wanted to help him. And so he established a training situation for him through the Kessler Institute in New Jersey, primarily for physical therapy, but they also had a member of the team that was a speech pathologist. And of course, I was involved in the retraining of the singing for that particular patient. But these kinds of centers like the Kessler Institute that are very athletics oriented and also have a perspective on long-term care. The Kessler Center has done a very good job of dealing with the prolonged intubation of several people. However, there are some who have a serious injury, and the long intubation does not allow them to recover for a career.
Thank you.
Mixed results.
Thank you. I would like to ask Alan and then Soledad, because Alan is dealing, as you know, with she's the director of Estonian Music Conservatory, and I don't know which is your experience with long COVID performers, mainly singers, but also with instrumentalists. Do you have had some experience about the complaints in long COVID, Alan?
In Estonia, and singers, we had quite a bad situation when we had this first wave, and then quite many singers, especially in choirs. We have several professional choirs who became ill, but as far as I know, no one of them had to be taken to hospital. So, and I don't know anything about long COVID. So they survived well, actually. And now again, right now we have quite high contamination in society, but everything is quite open. Theaters work, choirs work, and everybody, not everybody. We have also anti-vaxxers and some of among singers, which is a problem. But I say 95% are vaccinated, and and also we test 3 times a week at least professional singers. And right now I have actually no information that anybody has become sick from COVID. So we don't know how it goes further, but we are quite lucky, and we hope very much that we get stop this raising and back to the normality. So generally I am positive and optimistic toward the future, because we will have shown also medicines to cure COVID and more vaccines and this third dose, and so I'm positive.
Thank you very much, Alan. And I remind everybody that Alan is the president of the next Pan-European Voice Conference next year, and Collegium Medicorum Theatri will have a session with him, and we shall enjoy our dear friends from PIVOC also. So we have quite an academic activities next year also. Please,
yeah,
Soledad.
we open our registration 22nd of November, so very soon, and are waiting for abstracts for
yes.
presentations and whatever suggestions for the conference. So
Yes,
Tallinn is a wonderful city, so you are all welcome to Tallinn.
Yes, thank you. Yes, Ron, you were going to say something? Ron?
Thank you. I found the students we are working at the university by Zoom and Meet, and the most common cases are loss of quality, fatigue, and at the beginning depression. Now they are a little bit more optimistic, but there is only one case that show a change in the pattern of vibration of the vocal cords. It's very strange because she has problems with the acutes. We thought it was a problem of the cricothyroid, because it doesn't have a movement, but it wasn't that. She can. It's a problem only with that the movement in the pattern of the vocal cords. It shows a difficulty only there, and probably must be with that. With I don't remember the name.
Myography or electrostimulation?
Yeah. Mm-hmm. It shows that I have a problem with the cricothyroid that she didn't have before. After COVID was that, but they can't. They really don't know what's happening with her. It's the only strange case. The other ones are asthenia, loss of vocal quality, loss of intensity, but not more than that. Thank you.
Thank you, Soledad. I don't know, Andrea Ricci Maccarini, if you want to make some comment about long COVID and performers, actors and singers in your population, Andrea.
Can you hear me? Can you hear me?
Yes, just speak a little bit louder, please.
Yes, I have no direct experience about artistic voice. I have experience about normal dysphonic patients with long intubation, with problems of movements of the vocal folds, of course, and it's a big problem because sometimes we have to perform a partial arytenoid with macular technique with the laser. Maybe Orietta Calcinoni has an experience about artistic voice problems directly, maybe.
Yes, thank you, Andrea. Ron, you wanted to ask something or to make a comment, please, Ron?
No, not at all, because I have not experienced directly about artistic voice problems due to COVID infection.
Thank you, Andrea. Yes, Ron?
Actually, I have two questions. One for Soledad. As the actors on stage, especially musical theater and straight acting, come back to stage, is there a change in the physicality and the blocking and the amount of motion on stage because of distance, as well as because of maybe recovering from some respiratory aspects? So anything on the stage from a physicality point of view, I'd be interested in. And the other question, before I screw up my microphone again, is what's the prognosis for more deviant viruses coming off? Are we going to have another surge here pretty soon, especially in the wintertime?
Yes, Ismail, you want to say something about the first question, the physicality of the singers and actors, performers? Your micro, please.
Thank you. It's a good question because the physicality is affected in some patients, especially who had a severe COVID infection. When they turn to the stage, they had physically reduced activity. Not singing is not too much affected if they were not intubated, but they were physically activated and they get easily fatigue, and it's completely heals after a year. It takes more time, but the exercise they do, the activity increases, but we don't have any objective data whether they achieved their normals because we don't have their normals now. Therefore, we just compare and we just questionnaire their results, and the results shows that they are happy after a certain time if they go on doing their jobs.
Thank you.
You're welcome. Thank you very much.
Yes, Mark, do you have some comments to this question of Ron about physicality? Mark?
Yes. No, I have no more experience that after being infected, they need some physiotherapy to be efficient again, to produce that regular teaching voice or speaking voice or certainly singing voice. But fortunately, in proportion, the amount of people who have been affected is not so important in a small country like Luxembourg. So beside the regular recommendation, I have nothing to add more. But this is true that there was a lot of stress when they had to go back on the stage. They were happy, for sure, but at the same time they were stressed because what they can read in the newspaper, what they can see in the news, they are still afraid of being infected again or maybe being at risk. And now in Luxembourg, they are discussing about the third injection, and they are concerned about getting their third injection as soon as possible. So it's more a question of confidence in themselves that real, I would say, disabilities, if I may say.
Yes, in my group in Mexico, I have been working all the time. What I've seen are both situations. One is, as Mark has already said, the lack of confidence in coming back on the stage. Also, the lack of confidence being near another colleague. For example, inquires. And also, there is also a physical problem, what I have seen in all levels of COVID-19. And I have seen that the digestive system has a lot of problems due to the reflux without any big digestive symptoms, but we have some redness and some edema in the arytenoids, and that makes some problems mainly by crescendo, diminuendo, or by ascending scales, or by singing. For example, Mozart, the flexibility for coloratura is not so easy in all levels of COVID. So the question here would be, is it only physically and of course emotionally, or is it both? And my thinking is that are both situations. So that's why, for example, for all COVID performers, I definitely recommend that they have vocalization more or deeper than they usually do. I don't know which is your recommendation, Bill, about this situation. Ray, have you gone, Ray? Ray? Oh, he go. I wanted to ask him also. Yes, Will, because I think to have again the complete function will bring what Mark says, the complete confidence again in singing. And also, there are so much information about the aerosols. So I think on this stage we have to change a little bit about the the position of the choir in comparison with before. I don't know, what do you think about that, Will, Ron, everybody?
Well, if I can just mention a couple of issues to answer Soledad's question, I'm not a physician, but it sounds very much like it's a superior laryngeal nerve paresis. If Pik Wu is still on, he might want to comment a little bit about that. But in my wife's situation as a speech pathologist, she is seeing a marked increase in superior laryngeal nerve paresis in the general population. I would suggest that much of that might be COVID related. But in many of these cases, in the cases of professional singers, she's able to get them back into their careers in a matter of a couple of weeks. So vocal exercise, if the patient is accustomed to doing vocal exercise to solve a problem, then they can return to work very quickly. And that, again, is a testament to the physicality. The respiratory work that she does with them and the vocal exercise work that she does with them is very specific in getting that cricothyroid adjustment to work when they have had a little bit of a reduction of recruitment. And the term paresis generally means that it's a temporary situation rather than permanent. But we are seeing a lot of those cases. And again, I'm not a physician, but those physicians that are seeing these cases could probably make a comment. We're seeing a lot of them in New York City.
So usually when I receive in telecommunication examination, for example, when they are active in COVID, I do say they have to begin with some easy breathing exercises, some humming exercises also. And when they are ready and away from active COVID, then we begin with all the activities of singing or acting voice, like breathing support, and of course flexibility in all the range and tessitura, and of course resonance. And also, what for the second questions that Ron said to us about the pandemics and another viruses, of course, I think we are in a world, in a global world. And when I was first asked by broadcast and television if we were going to have SARS-CoV-2 here also in Mexico, I said, of course, they are flying first class in jumbos, so they are coming. And this is the nature. Of course, we are dealing with climate change, with stress in the human bodies, and many of these issues are going to make easier for another microorganisms to come and develop another pandemic. So what I think is we have to think How can we avoid so much damage as we had for SARS-CoV-2? It's not only a matter of science, but a matter of hygiene, of personal care, of washing hands, and personal contact. Of course, in Mexico, we like very much to embrace us and to kiss each other as a regular greeting, but I think we have to change a little bit of habits. I don't know, Ismail, what do you think? Because you are in Turkey, what is your opinion about the new possibility of pandemic? Because Ron, unfortunately, I think we are going to have more pandemics because we are too close to one to other, and the microorganisms are also very happy. Coronavirus's family is a big family, for example. Yes, Ismail. Microphone, please.
I wish I would be an infectious specialist and would say that there will be some pandemias or not. It's difficult to say. But in the history, we saw that the pandemias or flu pandemics, the similar things happened and similar precautions are performed. And first of all, in the future, we will take care of ourselves. Last year, I went to Japan and I was visiting Tokyo, and I saw people who were not 2 years ago in December, and I saw people wearing masks. And in that time, there were not pandemics, so it was something different for me. But now I realize that we are doing this. So I think in the future we'll be very sensitive to take the precautions against any kind of infectious pandemias or endemias, whatever it is. And also we should care the society, not ourselves, but also globally, because we are all affecting each other. And also we should keep the art and the business keep running. Therefore, yes, we should be prepared. The infectious people, the microbiologists say that we are. This may be the first one. There may be other infections may come and do the same thing again, or coronavirus can be come with a new mutation. So these are the dangers, and these are that we have to be very careful. In the last 100 years, we saw new diseases like HIVs, etc. So we should be very careful about it.
Yes.
What do you think?
Thank you. Alfonso, do you want to comment something about this very important issue? What Ron says about new viruses and pandemics?
Yes, I have a question for all, above all, for Mark. In some the other day, a logopedist called me to say that they have many patients with bilateral vocal cord paralysis, but a lot, perhaps 5, 6 in the hospital. What do you think? What is the best intervention that in a vocal cord paralysis that is blocked and the result as nothing?
Yes. Hopefully, when you have a bilateral vocal fold paralysis, of course, you can perform an EMG to see after 2 or 3 weeks to see if it is there are still some activities. But anyway, you hope that it will be temporary. So you want to, in a way, to protect the airway, the voice, and to protect the airway as well. Tracheotomy has still a place. If you perform a nice low tracheotomy, you protect totally the larynx if it is perfectly followed. But people hate tracheotomy. So the way I deal with is dyspexia, according to Lichtenberger, because you open the airway and in a way you protect the cords, which is not really true, because if you leave the thread for more than for 5 weeks. Finally, the thread enters a little bit the posterior part of the course, and you have a scar, but it doesn't affect so much the vibrating part. So what I'm used to do to avoid the track is dyspexia according to Lichtenberger. And in some cases, after 3, 4, 5 weeks, you can release the thread. You see a good mobility, but I must admit that you have a posterior scar just above the vocal process, but fortunately it doesn't affect so much the vibrating part. But yes, there's still a place for the tracheotomy if it is nicely done, if it is nicely followed. Tracheotomy is not unnotated procedures, but many people just don't like it or refuse it because, yes, it's a bad word when you have a tube visible, they don't like it so much, yeah, or at all. But the terrible thing is that I started my career in the late 70s and early 80s. This is just the same problem right now. People in the ICU, they don't call you on the right time. They call you too late. They want to have a long time intubation instead of proposing this patient or the family of the patient a tracheotomy. Tracheotomies are not performed enough. So very frequently they combine a long time intubation with its shortcomings, with a poorly performed tracheotomy. They try to do what we call puncture tracheotomy, which is usually too high in the neck. And so you have the shortcomings of the both. This is the most terrible situation. So I would say, if you go for a long time, if you expect it, long time intubation, please do a tracheotomy. And if you are dealing after that with a patient that you see yourself, the PECSI of Lichtenberger are certainly to be considered.
The problem of this patient is many of them are very young, and he's 30, 40 years old, and his life changed a lot. And I think that this decision is very, very, very difficult for a young people. Also for old people, always is difficult.
But fortunately, we have not so much young, I would say, people in the 30s. What I've seen is mainly people in the 40s and 50s having some problem with obesity or diabetes and things like this. But fortunately, I didn't see so much of young people in the 20s or 30s.
Yes, we in Mexico, we have many intubations patients, unfortunately, before the vaccine, and we are a vaccination country. That means that we have a vaccination culture. So for example, Mexico City, that we are around 20 million in one city of inhabitants, we have almost 97% of vaccinations with one dose. Of course, we have all kinds of vaccines, and but before the vaccines, we had a lot of intubation also for young people and also for many performers, and that was not so easy. What I do think about this is that as much as possible, we have to give the information for other specialties like general surgeons and things like that with performers, that they have to be a little bit think about larynx more than think only on tracheostomy. But also after that, after tracheostomy and after the person is at home, we are having many courses that they have to make breathing exercises and vocal exercises. And of course, we need the team of a vocal coach or a singing teacher and phoniatrician and ENT in order to have, again, the patient in a good perform situation with the larynx. But I do think, for example, if we had in Mexico many years ago, we had a small problem with the H1N1. If you remember this influenza that we had Actually, the first place to have this influenza was United States. And United States said, no, it's Mexico. So it was like a little political situation. But anyway, it was not so long and we didn't have so much problems, so many problems and so many complications as we do now. So what I think is we have to work in teams, medical teams, and of course with our dear colleagues, voice therapists and speech therapists and vocal coaches and singing teachers in order to have all the same criterion to avoid as much as possible damage in the larynx. And also what I have seen is not only because of intubation, but also because of the digestive system problems. We have had in Mexico City last year many Helicobacter pylori infections with reflux, and it didn't have anything to do exactly with intubation, but had to do with COVID and with the imbalance of the immune system in the gut. And also another problem is, of course, the stress that have been already said by Mark, by Ron, and Vil, and Alfonso, that all this stress make a lot of big problems. I don't know if you want to add something, Ismail, about this intubation problem. Micro, please.
I'm not in a hospital now, so
if you can speak a little bit louder, please.
Yeah, I'm not in a hospital now, so I didn't see a lot of intubation problem patients. I'm caring most patients in the outpatient clinic, so I will not give a very good information about that.
Thank you. Well, I wanted to ask Bill about the position of what happens with his colleagues about having this tele therapy or virtual therapy, and what happens with the feedback of the students, because you have already said, Bill, and I agree completely with you that it is technically difficult. We have seen that with the wonderful presentation that we saw today, that sometimes there is delay, sometimes one PowerPoint is not compatible with another PowerPoint, but with the sound of the singing voice and the acting voice is very difficult. Which are the opinion of your students or clients, and also which are the opinions of your colleagues that are working under this situation, virtual situation?
Well, the virtual teaching platform for one-to-one lessons is working very, very well. It was a learning curve initially, but the only thing we have to really be careful about is what we see visually is not always the truth. So when I'm working with a client, I must insist that I see a side view of their posture, because the posture is not always what you think it is when you're leaning forward into a computer screen. And in general, that is one of the biggest problems that I'm seeing with telemedicine with some of the practitioners. In the case of Dr. Carroll, she doesn't let them get away with anything. And so she's very much a fascist about posture. But telemedicine has really been miraculously helpful for speech pathology because people that can't get out, can't go away across town, or can't even go to a different community to get speech therapy intervention are coming out of the woodwork, literally. And Dr. Carroll is seeing more patients per week than she was before COVID. And so the telemedicine is working out very well for her. The remote practice that I'm doing as a singing teacher is the same number of clients that I had 3 years ago. So essentially learning the pitfalls of what we are doing when we're doing the virtual teaching or the virtual treatment requires some adjustments. And for me as a singing teacher, the biggest issue is respiration and posture. So that is the thing that is not always easy to see on the screen, because if someone is like this, you may not know that they're terribly out of balance. But if I take them from a side view, the side view always tells me the truth about posture. And so that is the only real difficulty. Now, the difficulty about a latency and the feedback situations is that we cannot sing at the same time when we're doing Zoom or FaceTime. But if we are using one of these other technologies like the jamming software and hardware platforms, you can get an audio only feed where you can actually sing together with someone, and you can actually play two instruments at the same time. You can actually rehearse if you have these technologies. These are a little more expensive than using your smartphone, but they are very good solutions. But in terms of telemedicine is working very, very well. Dr. Carroll says that the only ones that she cannot really help effectively are the ones that she needs to do a massage for the neck or for the shoulders. Sometimes she does a laryngeal massage as part of her training, and those have to be in person. But she is simply telling them that they're not going to get the result through telemedicine for those specific needs. But for all of the other aspects of her speech therapy practice, she's getting great results.
I don't know, Soledad and Alan, if you want to add some comment from this situation, because it is a problem, as Bill says, that you have the complete body in the screen, but it is also a problem for the teaching voice professional. For example, if you are not sitting properly, Bill, for example, for you, or things like that. What do you think, Soledad and Alan? Soledad?
The latency it's a problem because it can't allow to play the piano simultaneously with the singer or the actor. The other problem with the actors is that they feel the lack of contact with their partners, and that makes a lack of concentration. But they are very committed to their work, more than when they are face to face. I don't know why, but I had wonderful results for the work, probably because they are less, and the ones that are going to classes are committed, they want to stay. No, I don't know, but it's for me it was a good experience at the university in that particular case. No, the commitment. But
Thank you, Soledad and Alan. Do you have some comment?
Yeah, of course, this push is very important, and that if you work with camera, that this is good idea. Taken from this profile, then you see it better. But I think the best is on-site, real. Not distance learning, but one-to-one in classroom. And at least in Music Academy, we are not doing anymore these online lessons. So we prefer to do vaccines and wear masks outside classroom, but of course singing with mask and teaching, it's very difficult, and I think it's almost impossible. So of course there are always danger of contamination, but no. So far, at least in Music Academy, we have been lucky. We have not had this year any students who became sick.
Yes, and the problem in winter time is that you cannot have so much ventilation as it is needed in these places. It is not so easy in winter time, mainly in very cold weather like you are in the States and Europe. And talking about tele-examination, Mark, because I was working some years ago before pandemic, I was making some speech and voice and hearing therapy, and also some some examinations, not physically, but from the voice and of course the medical history. I was using platforms many years ago, so it was not a big issue because I was already accustomed to that. Of course, it is not the same in the medical examination. But for example, last year when COVID was very strong, I didn't allow any COVID patient to come to my office. Either I send them to the laboratory or the laboratory came to their houses to take a blood sample or something, or I send them to the hospital if necessary, because I had to protect myself and I had to protect them also. So we had a telemedicine consultation and of course examination, for example, indirect examination of the nose, if you are breathing properly. And of course, we could see the throat, we could hear the voice with some samples, but it was not a complete phoniatrical examination and laryngoscopical examination as we used to. So which is your experience, Mark, about this tele-examination? Because sometimes you have to do that, even though it is not the best idea, but sometimes it's like that.
Yes. Well, if I may say myself, I hate telemedicine because I'm a medical doctor and I like to see and check the patients. For me, video endoscopy is my grail. So, of course, with telemedicine, I can discuss with the patient, I can give recommendation, but I miss the examination. So, for me, it's not. I cannot get any good opinion without checking the patient myself. So, giving recommendation, yes, it's not so bad, of course, but I missed the examination. So, as much as possible, I recommend the patient to come and see me, and using this special mask that I get from my friend Antoine Giovanni from Marseille with this little hole. It was a way to be able to have a good examination. So for my own practice, telemedicine is not satisfactory at all. But I understand when you are a speech therapist, and if you are able to treat the patient just by looking the way they behave, looking the position, as Bill mentioned out, it's okay. But for me, laryngologist, yes, I need to check the airway.
And Alfonso, what do you think? Because, for example, in my personal experience, Mexico country is very large country, and we were in pandemic, and not everybody can fly because of this or whatever. So it was better to hear something, to ask something. Of course, it is not ideal and it is not very proper, but it is at least one support in the medical situation. Alfonso, what was your experience about this?
I think the same as Mark is very difficult to if you have a patient that have a problem here, you must see if the problem, what kind of problem there is. For this, telemedicine is good, or medicine that, or the help that you can do in online with a person is important. Also with WhatsApp is important, but in the end you must see and see take a decision that what must I do for the best solution.
Yes, I agree completely, but I think sometimes, for example, many patients that were having throat problems and they were with very severe dysphonia, they didn't want to come out of their houses, even though in my clinic is everything completely separate. We had all the protections, and I myself was here with the big respirators, with HEPA filters and everything. But they didn't want to come outside. And sometimes we have cases like papillomas or carcinomas, but they didn't want to come outside. I don't know, Ismael, if you want to add something about your medical point of view of telemedicine.
I think like Mark because uh, I most of the patients wants to have the telemedicine, and they want us to put diagnosis and give some medicine, and it's hard to do that. And first of all, I recommend them if they have an infectious symptoms, I recommend to do their own PCRs, and if they are negative, so we call them. And if they don't have, they cannot do the PCR, we have the rapid tests. So we first call the patient and do the rapid test. If it's negative, we continue the examination. So it's hard to estimate. We may, although an experienced laryngologist can understand the problem by the voice or by the history, but it's not 100%. So we have to do the endoscopic examination, stroboscopy, and put the diagnosis. So I'm thinking like Mark.
Yes, so I think it's a great challenge that we have been in this 1 year and 10 months of pandemic problems. In Mexico, we are in Mexico City almost fully vaccinated, but on the country we are about 75% of vaccinations. And now come the other problem, the third vaccination or booster, and also how are we going to deal with this exchange of viruses through the artistic voice. Acting, singing is not so easy. I don't know if somebody wants to comment before we close this live discussion. Somebody wants to discuss? Yes, Alan?
To show you one thing, which is a BioBlock spray, which is elaborated in Estonia, and it contains antibodies against COVID. And I think that this is one thing which really helps. If you spray it to the nose each 4 hours, it's high tech technology. So in world there are some things like that.
Uh-huh. Yes, we shall look at that if you can send us the information, because as we know, it's not only medical treatment, but there are also
this is medical completely.
And it's like a vaccine, isn't it?
This is not vaccine, actually. It prevents these viruses to protrude to the cells. So it's antibodies from ternous milk of cows. This is special technology, and our scientists have elaborated this product, and it's only sold in Estonia. I think I'm not aware whether it's possible to buy abroad, but such things exists in the world. Just I want to give you information that it may help if you really use it if you are in crowded environment, or if you can't wear the mask. It helps some hours. No, they say 4 hours, and then you must spray again.
Anyway, it is important and interesting to see all the research that they have done with this BioBlock. If you can send us the link, and then I can send to everybody. So I thank you very, very much. We didn't talk so much because Ray went away, but I think also resonance problems due to long COVID or to acute COVID are very important for artistic voice. And I thank you dearly, because I know after each presentation there is a long time that you have invested but I think the presentations were wonderful. So I thank you, Mark, dear Mark.
My
I
pleasure.
thank you very, very much. Kisses.
Thank
And
you.
Alfonso, Ismail, our dear Bill, and of course, Soledad. And well, to be with us, Andrea Ricci Macarini, ciao. And Laura Ramos, very nice to see you again. Erenio Natale, as always, invited, and Carlos Manzano. And do not forget, please, to invite non-COMET members. They have a special fee for the next Zoom sessions. And of course, we are grateful from the COMET board that you pay 2022 and Zoom meetings as quickly as possible. So I thank you, dear. Thank you very
Bye-bye.
much. And thank you to everybody.
Ciao.
And keep safe and see you
Ciao.
soon. Bye.
Bye-bye.
Bye
Good
bye.
night.
Ciao.
Bye-bye.
Bye.